I would like to call the public safety hearing in order. Today is Tuesday, January 26th. It's 2 p.m. Madam Clerk, will you call the roll?
Alderman Oldenburg.
Present.
Alderwoman Clark Hubbard.
Here.
Alderwoman Key. Alderwoman Velasquez. Alderwoman Sanye.
Present.
Alderman Aldrich.
Present.
Chair Narayan.
Here.
Alderwoman Keys. Alderwoman Velasquez. We have 5 present. We have quorum.
Thank you. With that, I'll entertain a motion to approve the minutes of Thursday, January 9th, 2025.
So moved.
Second.
Madam Clerk, will you please call the roll?
Alderman Oldenburg.
Aye.
Alderwoman Clark Hubbard. Aye. Alderwoman Keys. Alderwoman Velasquez. Alderwoman Sanye.
Aye.
Alderman Aldrich.
Aye.
Chair Narayan.
Aye.
Alderwoman Keys. Alderwoman Velasquez. We have 5 aye votes.
With that, we've sustained the motion to approve the minutes of January 9th, 2025. We have no board bills for review. We have several resolutions, and then we're going to move into discussion item number 1. We're just going to take those resolutions in order and vote on them. We've heard public testimony twice on each resolution. The police department has made changes to those resolutions, and at this point, with the ordinance the way laid out the way it is, we just need to simply hold a vote, and then we're going to move into the jail conversation. So at this point, we'll take up resolution number 186.
Alderman Ryan, I'm not sure if we were having public comment. It stated that we would. We have 2.
We are not taking public comment on these at all today.
Okay.
We've taken public comment on these on the resolutions twice, and we're doing public comment on the jail discussion next week. That was sent over to the clerk Monday.
Thank you.
Yeah, because Dr. Mahdi has a 3:30 stop today. So in order to make sure that we can have that discussion, we have to kind of prioritize these things. So at this point, we'll move to resolution number 186. And for these resolutions, I'll hand the gavel over to the vice chair to hold the meeting while I present the resolutions.
All righty. Resolution 186. Alderman from the 4th, you have the floor.
All right. So we've discussed resolution number 186 for quite some time now in committee. So at this point, I would move that we pass resolution number 186 out of committee with a due pass recommendation.
All right. The motion was made by the Alderman from the 4th, seconded by the Alderman from the 2nd. Any discussion? And I would go in, I guess, order of, well, I guess we got to, all in favor? Sorry.
You have to take a vote.
Is there any discussion on the resolutions?
No.
Okay. Well, I do have discussion on the resolution. Alderwoman from the 7th will go first.
I did have some remaining questions left about updates and things that were requested that were not updated, but since no one is here to speak before us today, I guess those won't be asked. But I do think there are.
I do believe that there should be someone from the department in the room if there are any specific questions.
I just in lieu of what you said about the Department of Health director needing to go, who even though I think she's saying she does have time, I just think my questions would take they wouldn't be quick. And it looks to me like, Chairman, you want to move quickly through this. I don't, is there an option to maybe do that discussion first and then come back to this? Or is this definitely the order that you want to go in? Because I feel like there was a lot that was uplifted by the community last time they're not here. I also really don't like that we're not taking public comment from them when they're here, and I hope transparency. Um, so I just wanted to put all of that on the table for discussion, but of course it's up to the chairman of how we go about the agenda and how we take votes, but I do have issue with those things.
Understood. Yeah, and at this point, at the request of the administration per the ordinance, we have to vote on this basically. And we have heard public testimony twice on this. The police department has made substantial changes. I understand if anyone is not in favor of any of these right now, but I feel like based on the ordinance, my hands are kind of tied in the fact that we just need to have an up or down vote.
Okay, understood, but also our agenda is notice to say that we are taking public comment, so I'm just saying that I think that piece wasn't clear. I do see folks here. I just don't know if it was clear about that piece, but that's fine. I think now they know that it is, that's not at our discretion as members. Yeah, I will let Alderman Aldridge go, and then I'll take it back if that's okay with you.
Yes. Thank you, Alderman from 7th. So first, some clarification. I want to make clear that we're not making it seem like we have to get these done because the health director has to go. She is stating she can stay. If there was an urgency of time constraint, Mr. Chair, I would say maybe we should have started with the jail discussion first, if that was the reason why you want to start resolutions. Secondly, our rules, and I hope we're not violating them, would ask maybe even the clerk to call the actual clerk, because we were noticed up for public hearing. I do understand we've had ample amount of discussion. I appreciate the department coming plenty of times and answering. I appreciate the community coming. However, our rules on this, when this was set up for public comment. So I think there is a question if we break in our board rules by actually setting it up and then people coming and then you're saying there's no public comment. Thirdly, on all these resolutions, I will be voting no. And Mr. Chairman, I have questions for you. When was these resolutions posted on the city's website? Let me be clear, not the resolutions. When was the updated use plans that was made of edits posted on the city's website?
I believe that Sarah Baker is in the room, and she would be able to give you specifics on that, I believe.
Gotcha. Just though, before we get to that, as a bill sponsor, and you understand there's other departments working on this, but as the bill sponsor, are you aware, because these are your resolutions, are you aware when the exhibits for the updated use plans was actually posted on the city website?
I know when I was told that they were posted, but sometimes I was told, hey, those went up yesterday or they've been up. So I wasn't in the room as they were actually uploaded. So I think that if you're looking for that specific information, Sarah and Monet would be people who could tell you more specifically the exact timing on that.
Gotcha. Just for clarification, these were posted on the city website. Some was posted as early as today at 9:00, and then some was posted as early as yesterday after 5 p.m. The updated use plans, the resolutions have been sitting on the calendar, but I will commend the police department. They came in front of us. They heard from the community. The community had a lot of questions on some of these use plans. There was some changes that was made before we actually seen the use plans. There was a presentation, a very detailed presentation that they set up, and that was posted on the website. But as of when the use plans from the Board of Aldermen or being on the Board of Aldermen, that was as early as 9 p.m. for some of those use plans this morning, and last night after 5 p.m., which, if I could be honest, some of these I was going to vote for because I do think there have been some collaboration and cooperation with the legislative branch and the department. But I don't feel comfortable voting for use plans that was not in front of the public at least in a week amount of time, and literally was just posted this morning on the city Board of Aldermen website.
To that, I would just respond that after the last hearing that we had on this, we made it quite clear that they were and had been on the police department's website and how to access them there, which certainly complies with the letter of the law on this.
Gotcha, Alderman. When you work on legislation that involves forestry, do you post those board bills on the forestry website?
I do not, but I think when we have hearings, public hearings that are well attended, and we point to people exactly where to go to find something.
And usually when we point to where they go to find it, isn't that on the Board of Aldermen website?
Typically.
Probably outside of this resolution, 100% of the time, any board bill that we're working on, any amendment we're working on, any presentation we're working on, for the public to be able to see it and to be able to follow along in the legislative process, haven't we always posted those exhibits, those board bills on the Board of Aldermen website?
Yeah, typically. And in the future, there's several things about this underlying ordinance that absolutely need to be cleaned up. We've seen that going through this, and I'd be more than happy to work with you on that. I feel like my hands are essentially tied on this when it comes to the timing because of the way that the ordinance is laid out and where we're actually at in the process right now.
And I want to be clear, you were a yes vote on the piece of legislation and like several other pieces of
Absolutely.
yeah, so I do
Absolutely.
no,
I'm not blaming anyone there. This is just the first time that we've gone
No.
through it, and we're working through some of those kinks.
Absolutely, but what I'm saying, I appreciate your support on the legislation, and as you say, or as you said, there are probably some kinks. You know, when we pass legislation, we have to come back and amend it. My only thing is when you say your hands are tied, I do know there's a time frame that we would like to get them out from the administration. That is not the time frame that, just to be clear, that says the ordinance that we have to get it passed this Friday. Since these are a resolution, as quick as they are passed out of this committee, they will be on the floor Friday. So the ordinance doesn't tie your hand saying that we have to get it passed today. I just want to be clear, that's not what the ordinance says, that it has to be done today. Again, my concern is that 100% of the time, anytime that there's a board bill or exhibits or anything that's posted on the Board of Aldermen website, and I think the department has, again, done a fair job of trying to get these posted. Maybe, like you say, in the future, we can work on making sure that that is fleshed out, but to post them on the Board of Aldermen website as of early as 9 o'clock this morning, and then say we should vote this out, knowing that we do have time to be able to still vote these out, in which, like I said, some of these I tend on supporting, but in lieu of like transparency, I just don't feel comfortable that we gave the public the most amount of time to see these resolutions. I'm not saying on the police website, I'm saying on our legislative body website, where we send every piece of legislation, every piece of amendment, every presentation has always been housed in one location, not on a different website. So that is just my concerns on voting these out today, is that some folks literally just seen these use plans 9 o'clock this morning. And I think the Alderwoman from the 7th had a discussion. I think the Alderwoman from the 7th, yes, had discussion on 186. Alderman from the 2nd. Correct.
I have similar questions for every resolution, so it's I can ask them. I can ask them now, and they will really be uniform to most of them uniquely. I don't know whoever is best to respond, but it'll probably be Miss Monet.
Alderwoman Saunier, I see you got a new name tag.
Switching it up. Switching it up. Um, I know last time I had asked about the. First of all, I'm sorry. Thank you for being here. Thank you for your work to the resolutions, for going back and providing updates. I've been following them through, and I do see that you've been working very diligently of them. I've appreciated a lot of the conversations we had, offline. So I just wanted to start by acknowledging that I do see the effort, and I know this is a new process. There's just some frustration on my end because I feel like we have political procedures and processes, and they're not being followed with this. And I feel like we should all, play by. I don't know who that is due to, and I know this is the first time, but it's just, these are the things that I use when I tell constituents, hey, this is our process. This is how it's going to go. So when we don't follow them, it's me who has to hear from them when they're upset now, like, oh, I took the time to be here and I can't even talk now, and I got to go back and explain that to them. So I just wanted to say, like, this is not, these questions are not like, nothing of my feeling or my tone is negative towards you. I think you've been working extremely hard, but I do have some frustrations with the process and hope we can get clearer on what it should look like. And I personally, I think alders, I think we do know better. We know our processes and follow these all the time. So even if I can help you by communicating with what that looks like. I just, last time we talked about the product manufacturer numbers, and I just wanted to follow up on that piece and where that is. And again, I will have this question for everyone, but where could they go to kind of locate that information or the closest things within the resolution to see in order to find the equipment themselves, like who the manufacturer is?
And before you begin, Ms. Monet, if you could raise your right hand, I'm just going to swear you in. Can you swear to tell the truth, the whole truth, and nothing but the truth?
Yes.
Thank you, Ms. Monet.
So
And state your name for the record.
Monique Centron, Chief of Staff. So in regards to the product descriptions and manufacturers, what we did when developing these plans was very similar to other cities who have done it. They are putting in the capabilities of the software or the product to explain what it can do. And then through the use plan, we describe how we use it. Because what we don't want to do is get into pretty much back ourselves into a corner where we say, this is the technology, this is the name, this is the brand, and then we don't like it and we need to change a vendor. So instead, we described what the capabilities of the technology are and then how we use it.
So you're saying the reason why product manufacturer is because product manufacturer will identify a specific product, and you want to make sure that if you guys get a product and it's not, you need to switch vendors for the same type of product service, but you need a different type of vendor or contract or product, that you're able to do that and you don't have to go back through this process because now you're using a new technology.
Correct, because again, it's not a different technology with different capabilities. We're looking to use it in the same fashion. It just might be, it's not the vendor we need. So, and I'll use body-worn cameras for example. We have a product that, okay, we're using it, but now we're looking at something else. And in those plans, I said, there's an RFP out for that. So yes, we're looking at changing, but it still has the same capabilities. It records our interactions. So we try to go into as much detail as about the products of, and their descriptions as much as possible, and their capabilities, and show what and how our department utilizes those.
And I also had a question about just the data retention policies. I think last time we were talking about how sometimes it said 90 days, but then there was conversations and then we moved to 60 days or 30 days, but I just wanted to.
So we were talking about, I think in that instance, it was LPRs being maintained for 90 days versus some of the camera video footage that's maintained for 30 days. And as far as the LPRs, it's 90 days, and that was something that we worked on with the ACLU and chose that 90-day period because we believed that is what we needed to retain in order for if we had any criminal investigations that we needed to look back at. Those are still footage evidence or, data, whereas the other one is like a film. So,
And do different, like, for example, like, let's say license plate readers versus, do you all use the same general, like, 30-day period for most of them? Or, like, for some of them, do you release the data much sooner? Like a body camera versus a license plate reader. You might hold a license plate reader, the data that you get from that, you might really only be holding for 7 to 10 days. You might be retaining body cam footage data for 30 days. I'm asking about, are they pretty unique throughout, or is there differences in that way?
they're specific based on the use plan. So like LPR had its retention period of 90 days, body worn camera, I can't remember off the top of my head, but it's mentioned in its retention. The cameras themselves, citywide cameras, that's 30 days. And that's in the retention portions of those use plans. So we tried to be very specific. We broke them down and listed them for each individual item.
Thank you. And then the other section, and we did talk a little bit about this, I think it just was about the cost of technology, all the parts that it moved through, from acquisition, operation, to the data retention process, to the maintenance process, all of those different cost of that. Were all of those factors into this, or is this mainly just the cost of actually acquiring the technology and not some of the other components?
So some of them, it accounts for all of that. Some of them are still under warranty, so I don't have those costs yet because we don't have to cover those. There's things that were one-time purchases that, you're not, it was kind of included in that cost. So I gave you as much information as we had regarding the cost. Now, I know someone had mentioned, about the Real-Time Crime Center, and as we stated, that's not really a technology, it's more of a hub. And when you think about that, I mean, the cost are what's the technology that we presented.
Thank you. I really think that's the extent of my questions for this one. Thank you.
Any more questions? Seeing none, motion was made by the Alderman from the 4th, seconded by the Alderman from the 2nd. Madam Clerk, please call the roll.
Alderman Odenberg.
Aye.
Alderwoman Clark Hubbard. Alderwoman Keys. Alderwoman Velasquez. Alderwoman Sanier.
No.
Alderman Aldrich.
No.
Chair Narayan.
Aye.
Alderwoman Keys. Alderwoman Velasquez. Alderwoman Keys.
Aye. Can you hear me?
Yes, we're voting on Resolution 186.
Hello?
Yes.
Okay, I said aye.
Alderwoman Velasquez. We have 4 aye votes and 2 noes.
All right, by your vote of 4-2, you have sustained the motion for Resolution 186 with a due pass recommendation. Alderman from the 4th, you are recognized on Board Bill 187, Resolution 187.
I move that we pass resolution number 187 with a due pass recommendation.
Second.
There was a motion made by the Alderman from the 4th, seconded by the Alderman from the 4th, or by the 2nd. Any discussion?
That's previous rule.
Objection, and I have discussion. Again, on the resolution for this, I would be voting no. I think it actually been a lot of good work put into this resolution from the department. I think there's been some concerns. I do think there is still more concerns on this resolution, but again, this resolution also is not posted in advance time for community to be able to vote on this, not voting on the substance of it, but more on the lack of to be honest, the alderman making sure that part of his bill was up on the website an ample amount of time so that people in the public was able to. Seeing no further discussion, Madam Clerk, please call the roll.
Alderman Oldenburg.
Aye.
Alderwoman Clark Hubbard. Alderwoman Keys.
Aye.
Alderwoman Velasquez. Alderwoman Sanye.
No.
Alderman Aldrich.
No.
Chair Narayan.
Aye.
Alderwoman Velasquez. We have 4 aye votes, 2 noes.
By your vote, 4-2, you have sustained the motion on a due pass recommendation for Resolution 187. Alderman from the 4th, you are recognized on Resolution 188.
I move that we pass resolution number 188 with a due pass recommendation.
There was a motion made by the Alderman from the 4th, seconded by the Alderman from the 2nd. Any discussion? Again, I have discussion. Echo again what I just said on my previous comments, and I'll be saying this for all resolutions, so no need to previous roll. Any of these resolutions, I do think, again, this resolution was not posted an ample amount of time for the public to be able to see these, just be aware of what we're voting on. Again, some of these were posted as early as this morning at 9, and some after 5 p.m. yesterday. Just not a way we should be operating at the Board of Aldermen. I know they were posted on the police end, on the police website, but we should have ensured that these were posted on our website in an ample amount of time so the people who look at the Board of Aldermen know that we were being transparent on our end. Seeing no more, does the Alderwoman from the 2nd or 7th is recognized on Resolution 188?
Thank you. I think this also might be for Chief Monet. It says, and I'm just going to read it right from the text, that ShotSpotter costs approximately $70,000 per square mile. $64,000 is paid through grant funding. $130,000 is covered by the Police Foundation, and $242,000 is funded by civil asset forfeiture. I just wanted clarification on, are these annual recurring costs or are these one-time occurring costs?
Their annual cost.
Okay, thank you.
Seeing no more discussion, Madam Clerk, please call the roll.
Alderman Oldenburg. Alderwoman Clark Hubbard. Alderwoman Keys. Alderwoman Velasquez. Alderwoman Sanye.
No.
Alderman Aldrich.
No.
Chair Narayan.
Aye.
Alderwoman Keys.
Aye.
Alderwoman Velasquez. We have 4 aye votes, 2 noes.
By your vote to 4-2, Alderman from the 4th, you have sustained the motion for a due pass recommendation on Resolution 188. Alderman from the 4th, you're recognized on Resolution 189.
I move that we pass resolution number 189 with due pass recommendation.
Is there a second? There was a motion made by the Alderman from the 4th, seconded by the Alderman from the 2nd. Any discussion? I will go ahead and stay on my soapbox of, again, saying this is another resolution. And I'm not even going to say soapbox. I do think these are serious, that these should have been posted an ample amount of time so the community and others have been able to see this. Again, this is the the 4th resolution that we vote on that was not posted on our website, at least with a week notice. So I will also be voting no on this resolution. Any further discussion? Alderman from the 7th, you recognize on Resolution 189.
Thank you. I think this one is for Chief Monet as well.
So she'll go back and forth, or you got questions on the other one for her too?
And not on everyone, on a few of them.
Okay.
Sorry. but you can sit in that seat if you like. I don't necessarily know that this is specific to this one, but there's two technologies, the SkyCops and the Cellbrite technology that don't appear to have resolutions. And so I'm just, are those like, am I missing something? Are they, I guess that's my question, is it looks like the SkyCops technology, which is like the video cameras and the mic, the intro to RTC and the Cellbrite technology, I don't see specific use plans for those
So
technologies.
Celebrate is under the resolution for the forensics, and the mobile trailers is under the resolution for the cameras. Those two, along with, Burla, Gray Key, Celebrate, those are the forensic technologies. They were grouped together, and then when we had community comment at that first meeting, I think December 11th and 12th, those days, it was mentioned that, they wanted everything broken down. They still are part of forensic technology. And as far as the cameras, all I did was break down exactly those cameras based off of just what the community comments were.
Yeah, and I did see when I was looking at just some of the exhibits and the resolutions were submitted at different times, so it could be that I just mixed them up since they were all submitted together. Thank you.
Seeing no more discussion, Madam Clerk, please call the row.
Alderman Odenberg.
Aye.
Alderwoman Clark Hubbard. Alderwoman Keys. Alderwoman Velasquez. Alderwoman Sanye.
No.
Alderman Aldrich.
No.
Chair Narayan.
Aye.
Alderwoman Keys.
Aye.
Alderwoman Velasquez. We have 4 aye votes, 2 noes.
By your vote of 4-2, Alderman from the 4th, you have sustained the motion on a due pass recommendation for Board Bill 189. Alderman from the 4th, you're recognized on Resolution 190.
I move that we pass Resolution 190 with due pass recommendation.
Second.
There was a motion made by the Alderman from the 4th, seconded by the Alderman from the 2nd. There was a request for previous row. I object. Any discussion? I will go with discussion. Resolution 190 also was just recently posted. This resolution hasn't sat on the Board of Aldermen website for more than a week, so the public can be aware of it. I would ask that, these resolutions, the way that our process work out at the board is once these are passed, since it's a resolution, it's not a board bill, it can go to the floor as of quickly as these are passed out, that we probably just give the community more time. If we do pass these out next week, they would still make the deadline before the Board of Aldermen goes down to make sure that these resolutions are passed. Seeing no further discussion, Madam Clerk, please call the row.
Alderman Odenberg.
Aye.
Alderwoman Clark Hubbard. Alderwoman Keys. Alderwoman Velasquez. Alderwoman Sanye.
No.
Alderman Aldrich.
No.
Chair Narayan.
Aye.
Alderwoman Keys.
Aye.
Alderwoman Velasquez. We have 4 aye votes, 2 noes.
Thank you, Madam Clerk. By your vote of 4-2, Alderman from the 4th, you are able to sustain the motion for a due pass recommendation on Resolution 190. Alderman from the 4th, you're recognized on Resolution 191.
I move that we pass Resolution number 191 with a due pass recommendation.
Second.
A motion made by the Alderman from the 4th, seconded by the Alderman of the 2nd for a due pass recommendation on Resolution 191. Any discussion? I will go into discussion. Resolution 191 also posted in proper time to give the community public or the public the ability to actually dive into these resolutions. And I would hope that, again, we don't have to rush these right away, that we at least wait a week so that the public can see. in a ample amount of time. Seeing no discussion, Madam Clerk, please call the roll.
Alderman Odenberg.
Aye.
Alderwoman Clark Hubbard. Alderwoman Keys. Alderwoman Velasquez.
Aye.
Alderwoman Velasquez. Alderwoman Sanye.
No.
Alderman Aldrich.
No.
Chair Narayan.
Aye.
Alderwoman Velasquez. We have 4 aye votes, 2 noes.
By your vote of 4-2, you have sustained the motion for a due pass recommendation on Resolution 191. Alderman, you are recognized on Resolution 192.
I move that we pass 192 with a due pass recommendation.
Second.
There was a motion made by the Alderman from the 4th, seconded by the Alderman of the 2nd. Any discussion?
Yes.
Alderwoman from the 7th, you're recognized on Board Bill 192 for discussion. Proceed.
Thank you. Chief Monet, you do not need this time. It's okay. You don't have to come up this time. I don't have any questions for you. I will just, help the Alderman from the 14th out. I really am flagging this for my colleagues and for SLMPD that if we're trying to build community trust and we're trying to build relationships, how does it make sense to post updating ordinances on the website the same day and then want to vote through? There are so many times that I have been flagged by my colleagues of you're moving too fast, this is rushing too fast, can you take a step back? You still have time for this on so many things, on so many issues, but on this, and at a time where literally not even 24 hours, which doesn't even, we have to post our agendas 24 hours before we have meetings in order for notices to be there. On the agenda itself, at the top, it says we're going to take public comment. On the bottom, it says we're not going to take public comment. And it's just, I feel like it is just so, especially around an issue that's so controversial, that is so critical to community trust and is in need of it. And I do understand that all of these are going to pass through, but I'm just saying, like, this is a large part of like people's frustration, and I share it, that this just gets to skate through and go through, and we're not gonna, ask those questions and do those things. And it frustrates me too. I have deep breaths as well. Like, I wouldn't say it if I didn't feel it. I just don't feel like this is following the process that other things are held to, and I have every right to say that. Thank you.
Any further discussion? I would echo what I said on the previous resolutions. I wish there was more time around these for the community to be able to digest them. Madam Clerk, please call the roll.
Alderman Oldenburg.
Aye.
Alderwoman Clark Hubbard. Alderwoman Keys. Alderwoman Velasquez. Alderwoman Sanye.
No.
Alderman Aldrich.
Aye.
Chair Narayan.
Aye.
Alderwoman Keys.
Aye.
Alderwoman Velasquez. We have 5 aye votes, 1 no.
By your vote of 4-2, you have sustained a motion for a due pass recommendation on Resolution 192. Alderman, you are recognized on Resolution 193.
I move that we pass resolution number 193 with a due pass recommendation.
Second.
There was a motion made by the Alderman from the 4th for a due pass recommendation on 193, seconded by the Alderman from the 2nd.
Request for previous rule.
Rejection. Any discussion? The Alderman from the 10th, you are recognized on Resolution 193.
Thank you, Mr. Vice Chair. Thank you, members of the committee. I just want to speak on a couple of things, since this is our last one, right?
Yes.
Yes.
Okay. First of all, thank you for the work that has been done, all entities that have put in work on these resolutions. The posting part is a problem on 2 levels for me. When it was posted, that is not ample enough time, but we are not also calling out who was duly responsible for that. And so making the perception that it might be one person's responsibility or one group, the sponsor, whoever, and it's not, I think that's unfair to the process. So until we can clearly say whose responsibility that is. I think that we shouldn't use that as what we're gonna have as a platform to not do this duty down here. As it relates to public comment, we're all elected down here by our constituencies. So everybody knows how important and how I speak on public comment is in the committee. But I don't have that authority in this committee. So while I disagree with Mr. Chairman about not letting public comment go forth, I do know that we all can take our positions to speak. So in speaking for my constituency base, which I spoke on it last week as well, the narrative that is being sometimes put out in the community that are against these use plans and against surveillance as a whole is not a reflection of the work that I do in my community. I receive calls daily about surveillance requests. In my community, maybe you don't know the value of surveillance until you become a victim. In my community, maybe you don't know the value of surveillance until those cameras talk when the community won't talk or can't talk because of the history of the relationship between community and policing, and that's understandable. That's why we have a responsibility to stand in that authority and stand in that place. I think that last week I called out for conversations to be had with entities and the administration and the police department, and both of those have told me that different conflicting answers to that, whether they had the conversations or not, but the work had been done. So if the work had been done and it's just about the posting of it, and again, there's nobody sitting at this dais' responsibility. I've asked a couple of different people and I still haven't gotten a clear answer on whose responsibility that is. Now we have a responsibility to carry this forth and be that voice for the community as we move these forward and do the responsibility of this work that many of us played a role in to even get us to this part. The efficacy is the other piece that's mentioned in all of these resolutions, and that was a point that was brought to me, so I took it directly to the police department, and they said that the efficacy will come within the annual plan, not within this first initial report. And so if anybody can show me where I'm not saying that that's the end all say all, but until the entity that can answer to that says that, and the entity that is saying that that's not true is not showing me where that's not the case, then again, I have to stand in the position of my people in the 10th ward and do the work and not come down here and show up down here, not that I'm not doing the work, but just in direct conflict to trying to be able to do the work. So again, I thank everybody that's put work into this, not just the administration and the entities, but the community as well. I continue to be open for conversation as well, but I'm standing on what I have to stand on for my community. I will respect you on that, and I would hope that you will respect me on that in my position, however you want to take that.
Any more discussion? Alderman from the 7th, you are recognized on Resolution 193.
I just wanted to say that the things that are posted now, I will, if you are watching this and you have emailed me, I will email you the posting today. Like I'm working on it now, but I will get you a copy. I want to just be clear about some of my frustration. I really do have immigrant population that lives in the 7th Ward. I really do have people that want to have abortions that are very scared of how this will turn out for them. I really do have LGBTQ members, like their concerns are very valid. And of course, I've said to them from the beginning, like there will be some surveillance into the city of St. Louis. I want to be clear, there's no bold ideas, but it's hard for me as their alderwoman to do my job and tell those organizations and tell those people, I'm going to keep you updated, I'm going to keep you in a loop, and then things get posted on the website at 9 a.m. I don't know who's responsible that is. I don't know if that's on the clerks. I don't know if that's on the chairman, but I know that as a voting member of this committee, if procedures haven't been followed and I'm not able to communicate with my constituents and my community accurately, then I vote no. And that's how you hold accountability and you say that there's a problem in the process. I know we all have things to uplift, but these are serious concerns. All of our emails are sunshine I'm not making any of this up. There are people who are asking me things, and a lot of times all of their concerns can't be met, but I can at least say, hey, complete transparency, this is everything that's being proposed, this is everything that's being moved forward. If stuff does not get posted until 9 a.m. with our calendars and our schedules, how are we supposed to have time to go through, read that, respond to all the emails, send that to constituents, and address and answer their questions? It doesn't even leave me time for me to, send an email and CC Chief Monet in it and say, hey, these are in the use plans, they have questions about this, can they answer this? If it's not posted, I don't have the ability to do any of that. So I want to just be clear. I'm not being, unfair or being unreasonable. I understand that these things are going to pass through. I was just looking for the communication piece, and I just wasn't in position to be able to do that for my community. Yes, it is one of the communities that has a lot of hesitancy around surveillance for very valid reasons. Some that are not even about SLMPD or the city, but state policies. While we have stuff up saying you want a bounty hunter and you're going to pay people to do it, like they have real concerns, and I have to go back to them and say, hey, this is the process. So this is going to be the process today. It's going to go to the floor, but I just hope in the future, and I'm happy to volunteer. I volunteer my time. I think that shows I take the time to read these resolutions. I'm very detailed. I will call whoever I need to 3, 4, 5 times. I'm willing to do the work, but I have to be in position to do my work. And at this point, we're taking vote. The best thing I can do to those concerned constituents is say, I got you on the back end. I'll, answer your questions how I can. This has been posted. I'll send it to you. But I think in the future, it's really important that we follow the processes outlined in the ordinances, because they're designed so that I'm not in this position and I'm able to tell them, any of them, hey, here it is. This is what you got. Here are the answers. Folks might be mad. They might not like it. I understand that, but I haven't even been in position to do what I think I do owe them, which is to be able to answer their questions and share information with them with enough time before we make decisions where they can feel like their voice was a part of it. Thank you.
All right. So on resolution 193, I will say, the reason that we're actually here talking about these, all these resolutions around use plans, as the one of, I would say, the sponsor, I also want to give some shout out to the Alderwoman of the Six, coming together, and after years and years of work of trying to get CCOPS, or whatever you want to call it, oversight of technology done, we was able to do it this past last session. And I do know that was done because of a lot of my colleagues here at the table coming together and saying, hey, this is important, including the chair himself. This committee, if it's been revising the DFOB language, having conversations about jail, doing these surveillance oversight resolutions, we do take, I would say, accountability and transparency within our public safety important. We do all represent different parts of the ward, and we come from different walks of life, but I will say I do think we all take it important during that process of getting this bill to a place where it is not perfect. And I think we will absolutely need to come back and make some edits, but that is all legislation that once you actually see it crafted and you see it and implemented, that it has to be fixed and changed. And I want to first commend and just say thank you to the community for bringing this work forward to the Board of Aldermen to make sure that it actually gets done, not just bringing it forward, the advocacy and reaching out and organizing and showing up, because this is our job to do this. And I know it is frustrating when it is posted publicly. When we talk about not sure who to blame, we do know that we all pass rules here at the Board of Aldermen, that we all said that committee hearings will be public, and it was on, now that was on the website for a week, that this would be a public hearing. And to the community, I know that while you guys don't get paid to come down here, you care about it because you also care about your city. I think our police department also cares about the city. That's why Monet has been coming to the table. If it's been the actual piece of ordinance and legislation, be real, when some others didn't want to come to the table, the department, like, you are there and you continue to be there and try to figure out how we can get it done. You've been coming to the table on these use plans. So you may see, like, I guess, discussion or disagreement up here, but I do think that we all are trying to get to the same place. And there are some hiccups that we are going to have to address. And I will always be a voice for the people that also represented me and knew where I came from the activist Rasheen to the public servant Rasheen, which they are all the same and entwined. My concern, honestly, with a lot of these use plans, it is some concern about some details that was left out that I think community has raised a point on. Could I've got to a place of saying in good faith, if we work or get these out, moving forward, moving next year, that we actually make sure that absolutely, that's not my concern. Mine's was that these were not posted in a adequate time, and I think as alders, if we're saying we don't know who was the ones who didn't post it, this is why we sit here and can ask questions and actually figure out those answers to make sure it don't happen again. I do think it was um, a problem on the board of alderman end that they wasn't posted. And being honest, I think Mr. Chairman should have been a little bit more aware of, as this being your legislation, that these pieces were posted on the website or not posted on the website. Not gonna hang you up on it because I do know you wanted to make sure this actually get done with the legislation, but I do think that is something that we owe not only to our ward, but we all represent as elected official individuals. We represent the city, and it's important just to make sure that people are aware of things that we're doing and being transparent in that process. I'm not going to blame, to be honest, the department because they posted it on their website. We dropped the ball and we didn't post it on our website to give the public the adequate time to actually dive into this. And I think that is, as a sponsor of the bill, I totally hold you accountable that this is something that you should have made was posted and not just saying Miss Baker or Monet, you had conversations. I would have made sure that these were actually posted so the community could have followed through with it. With that, I won't belabor the point anymore. I will be a no on this again, just because of the posting. It is not because of the work that Monet and the police department has put into this. It's not because of the concerns the community has raised. And I know there has been conversation between community and police, but it's truly about just making sure if we are going to cancel public comment, at least make sure on our end that we are having these up in a ample amount of time where people can. Seeing no further discussion, Madam Clerk, please call the roll.
Alderman Odenberg.
Aye.
Alderwoman Clark Hubbard. Alderwoman Keys.
Aye.
Alderwoman Velasquez. Alderwoman Sanye.
No.
Alderman Aldrich.
No.
Chair Narayan.
Aye.
Alderwoman Velasquez. We have 4 aye votes, 2 noes.
By your vote, 4-2, Alderman from the 4th, you have sustained the motion for a due pass recommendation on Resolution 193. And with that, I would return the virtual gavel back over to you, Alderman.
Thank you, Vice Chair. With that, we will move to discussion item number 1, the St. Louis Justice Center. We have Dr. Maddie, Director Coyle, and Director Ross, I believe, in the room there. Whichever one of them would like to proceed with the presentation that they have put together, please proceed.
Good afternoon. It's loud. All right. Good afternoon to the esteemed committee. Good afternoon to those joining us in the room. Thank you for having me. My name is Dr. Mati Hlachwayo Davis. I am the Director of Health for the City of St. Louis. I have prepared a brief overview to guide this discussion, and there are PowerPoints available that should be visible. With me today from the Department of Health is our new manager who helps with the oversight and evaluation for medical care in the jail. He's also assumed managerial oversight for our esteemed Behavioral Health Bureau. His name is Bo Richmond, and he is responsible for the incredible prepared documents before you today. I also want to acknowledge our Public Information Officer, Willie Springer, who also assisted. I'll ask Willie to provide you with copies of the presentation that you're about to see for your ease. Am I permitted to get started? Okay. So next slide, please. Today, I'm going to provide an overview of the work the Department of Health has been doing since October of 2023. I want to say upfront that it is important for people to understand our actual. We have oversight and evaluation responsibility over medical care in the city jail. We do not provide the care. We do not make decisions about anything that happens within the city jail. We provide oversight, evaluation, and recommendations to the commissioner, as well as to the director of public safety, who have ultimate decision-making powers. So let's start with the historical oversight. The Office of the Mayor requested that the Department of Health take over oversight and evaluation of healthcare at CJC, as the contract with the former healthcare provider for CJC was set to end on November 30th of 2023. The City of St. Louis Department of Health assumed that oversight role and was tasked with negotiating and securing an emergency contract with a new provider of healthcare services at CJC, which began on December 1st. So we just had under 2 months. I want everybody to be clear that that is almost impossible, but we did it. Since then, PCUSA has been providing medical services. DOH has also implemented policies and procedures for our oversight and evaluation functions, including monthly reports on healthcare metrics outlined by the National Accrediting Body for Correctional Healthcare, that I will refer to as NCCHC for the rest of this presentation. So in my mind, because I am an infectious diseases physician and a public health expert, but I do not have a formal background in medical services in jail environments, it was incumbent upon me to come up with a strategic plan that would bring together national experts for the city of St. Louis who understand the highest standards of care as it pertains to medical care. I reached out to them, and they provided me with the formal recommendation for the new provider. So this was a provider that we had to come up with in 2 months. This is usually a 6-month to 1-year task, but we got that formal recommendation from NCCHC as the national accrediting body for medical services in our country. And we went into contract with them to also provide recommendations, site visits, and reports to inform our recommendations to the Department of Public Safety. DOH oversights includes collaboration with the mayor's office, the correctional team at CJC, the medical provider, PCUSA, community partners, local hospitals and providers, and again, that National Commission on Correctional Healthcare, or NCCHC. Next slide, please. The contract between the City of St. Louis and the healthcare provider, known as PCUSA, started on December 1st. It provides for the delivery of reasonable and medical, and I want to just emphasize the reasonable and medical, behavioral and dental care to individuals under the custody and control of the city and detained at the CJC. I'm going to just review the scope of services because they are broad. It includes receiving and screening detainees within 4 hours of arrival at the facility, an initial health assessment of each inmate within 14 days, following admission to the facility, inmate requests for health services triaged within 24 hours, appropriate and timely medical detox services, regularly scheduled sick call, nursing coverage, regular physician visits on site, infirmary care, hospitalization, medical specialty services, emergency medical care, medical records management, pharmacy services, health education and training, and a quality assurance program and administrative support services. I will say that while my wish for all jail medical services in the country is that you get the same quality, level, and resources of care that you could get at Washington University or any other hospital in the country, that is not the reality. When I went into contract with NCCHC, we have asked them to do regular site visits. They contract with us, and I have asked them if we are so far out of scope with what is happening across the country. We are not. Is that good enough? No. But is that the reality of the situation? Unfortunately. The mental health portion of the services includes mental health assessment and evaluation at intake, at the initial health assessment, and in segregation. crisis intervention and suicide evaluation, medical administration and management, group treatment, discharge and aftercare planning, on-call services during nights and weekends for suicide attempts, behavioral health assessments identified during receiving screenings, psychiatric medication emergencies, psychiatric evaluation in housing units, and collaboration with medical staff on an integrated healthcare plan. Next slide, please. So PCUSA is supervised by the Department of Public Safety and the Department of Health. They are held accountable by a team of employees from these departments, including the Director of Public Safety, the Commissioner of the City Justice Center, myself as the Director of Health, the Commissioner of Health, CJC Health Bureau Chief, Bo, and our Behavioral Health Bureau Chief, Julie Gary. I've brought in another team of government services analysts and my trusted team of epidemiologists. The Department of Health, once again, provides medical and oversight evaluation. That work is focused on ensuring PCUSA is consistently meeting NCCHC care standards. So I'm gonna pause here and say, I want to acknowledge the devastating experiences, metrics that preceded the time that I had oversight and evaluation. While I acknowledge that, I find it unacceptable. These human beings are members of my personal community. So this is not something that I see as me or us versus them. I also want to acknowledge that it is impossible to inherit the sort of things that we inherited and see an immediate next day type of change. However, I'll be walking you through the progress that has been made in the last year that has been described by multiple national experts as truly unprecedented, as a beginning, not anything we need to applaud or that I need a pat on the back on, but the beginning of what needs to happen moving forward. I would encourage members of the public who have been long-term advocates, and I applaud advocates. We need advocates. We need accountability and transparency to consider one thing. It is easy to continue to adopt the talking points of the past, but I respect people who can say as loudly as they say what the issues are, that they can also call out when we are doing good work. My hope is that we will be able to see examples of such good work today. Next slide, please. Oh, sorry. One other thing that's on this slide is, so one of the first things that I implemented was routine communications and collaborations between the stakeholders. So that includes, but is not limited to, the weekly meetings were immediately implemented. And honestly, in the first month, we were almost meeting on a day-to-day basis between Department of Corrections, DOH, and PCUSA to discuss the current and previous week's activities. We had other meetings between DOH and just PCUSA, larger meetings with DOC, DOH, NCCHC, and PCUSA on a biweekly basis. We also developed a comprehensive corrective action plan that I'll show you a snapshot of later that came out of both the observations of my staff and the site visits, because our contract with NCCHC requires them to come here in person. So this is not somebody at their computer just going through charts and making recommendations. These are national experts that are required to be here at least bi-monthly in person to supervise every aspect of jail care and provide us with a report that informs the corrective action plan. Next slide, please. So let's talk about staffing in the city jail. This was a mammoth task. The last provider gave us just under 1 month, no, it was 1 month, no, it was 2 months notice, I beg your pardon. And so there is no time to recruit at a time where there are national healthcare, especially nursing, what is the word? English, help me now. Shortages, thank you all. This is when I say I am an immigrant, but since I've lived in this country for 20 years, I should know the English. So national shortages for nurses especially, it would have been an impossible task for them to take all of their staff and for us to recruit every single new member. So PCUSA did a phenomenal job of meeting with every single member of the staff, interviewing them, evaluating them for appropriateness, and then they retained between 80 and 90%, and then they went into partnership with a national staffing agency to retain the rest. All leadership positions are currently filled for medical care. The leadership team consists of an on-site support provided by a medical director, health services administrator, director of nursing, director of mental health. The most recent hire is one I'm particularly excited about. The new medical director joined the team after a lengthy career serving as an internal medicine and palliative care physician at BJC and WashU School of Medicine. So there are approximately 1.5 FTEs for nursing still open. PCUSA is actively interviewing for another full-time nurse in addition to as-needed nursing and LPN positions. But the other positions that are required to staff a jail of this size are currently filled. The full complement of staff consists of back support staff, but relies heavily on their frontline clinical team. Members of that team include physicians, a dentist, an NP, nurses, LPNs, a pharmacy tech, mental health professionals, a discharge planner. The other newest member of the team is the discharge planner. This is such an important position because we know that we want to help prevent people from having to come with negative health conditions. But once they leave, we want to empower them to continue to do things that prevent them from having ailments that make it difficult for them to thrive, whether or not they're inside or outside of our jail. The discharge planner is responsible for coordinating re-entry efforts for newly discharged inmates and works closely with individuals from my Behavioral Health Bureau and CJC Health Team to identify resources the inmates may need post-discharge. Next slide, please. So over the past year, the transition has gone very well. The city established and maintained a relationship with NCCHC to audit and develop programs focused on improving deficiencies. Those regular meetings I told you about went into effect. Those site visits went into effect. So we have built a living, breathing corrective action plan. You'll see a snapshot of it in a second. The plan includes an action plan tracker with dates, metrics, monitoring notes, audit, and debrief tools. All stakeholders, including PCUSAs, meet bi-weekly to review the plan and account for ongoing new updates. Examples for improvement areas identified during this audit process include, number 1, intake, number 2, detoxification services, and number 3, suicide prevention. The Department of Health is working with DOC and PCUSA to continuously increase the scope of detox services available at CJC and decrease the number of external trips made to local hospitals for withdrawal, assessment, and treatments. But once again, because the jail is not a fully serviced hospital, we will unapologetically send people to our area hospitals for medical services that are not appropriate to be managed within the city jail. Trainings was a big part of my strategic plan. So the Behavioral Health Bureau have conducted multiple trainings for all correctional and medical staff, identifying that one of the things I did before coming up with a strategic plan is understanding the map of every person that's involved in making sure an inmate sees a doctor, right? So when there is a question about inappropriate medical services, it's not just about whether the doctor did their job. Was there the appropriate communication from the inmates to leadership in the city jail to even know that they need to see a doctor? Was there appropriate and timely transport to get that inmate to medical? So we had to map all of that out and then make sure that there was regular communications with all those entities, which is not easy. It's easy to change the culture of something when there is one cook in the kitchen. For this particular situation, there are multiple cooks in the kitchen. And so that has been a challenge, but one that we have taken head on. We have done examples of trainings like man-down drills, suicide prevention watch, mental health response for inmates, burnout and self-care for the actual people who are working in medical, community resources training, and for PCUSA specifically, there's a plan in January to continue medical record entry processes and protocols. Because of the positive relationship the city has with PCUSA, the current medical provider, we're in active current discussions to renew their contract. Next slide, please. So this slide just shows you the average daily census for the jail. In 2024, you can see that was 722 inmates. This is compared to 550 in 2022 and 633 in 2023, respectively. Next slide, please. So let's talk about intake screening, which was one of the first priorities identified by the site visits as one of the critical areas that need. The intake screening is the initial screening done on detainees when they arrive to the CJC. The standard for this exam by NCCHC standards is to have this completed within 4 hours of arrival at the facility. The screening is important because it covers both mental health and physical health, medically clears an inmate for detention, and identifies any urgent health needs to be addressed. So it's an in-depth evaluation that is done, and we saw that there were a lot of challenges with meeting that national standards of doing it within 4 hours. So we looked at what all of the criteria was, and like I said, it's communication between the sheriff's office and DOC, it's communication between those two entities and medical. It's, do the inmates even know what's going on actively with their medical care? We'll talk a little bit about some of the grievances we hear the most, which is, I didn't receive any medical care, or no one is giving me my medications, as an example, and talk to you about what some of the constraints are. As a doctor, I cannot just say to somebody, hi, I'm meeting you for the first time. What medications do you think you're taking? Oh, I think I'm taking X at this dose. Okay, cool, here go your pills. That I would lose my license and think bad things could happen to people, correct? So we have the added challenge of intake also requiring the ability to reach out to local pharmacies, doctors' offices. They have rules about, you need to fill out this form, fax it to us, somebody will get back to you, maybe we can't get someone on the phone. So these are all the things that go into improving this initial health assessment. Next slide, please. So this is a snapshot of the report that we give to track how we've been. Areas of concerns are in red. Yellow means needs improvement. Green means satisfactory progress. You can see from this, we are tracking all the metrics for intake for every month with different metrics that are required by national standards. And the one that we are still working on the most is that 4-hour requirement. We are actually very close. I was on a call with PCUSA, and they believe that the latest month one will actually be in the yellow, so I'll be able to provide an updated note. But as you can see, since our involvement, most of these standards, almost all of these other standards are in the green. Next slide now. So what about health service requests? The health service request pathway is the method inmates utilize to request health care in the CJC. To make a request, they need to complete an electronic paper form. This allows them to communicate their health concerns in detail. The same request can also be made by correctional officers and medical personnel for an inmate to be for a physical or mental health issues. Those requests as classified as emergent within 24 hours, urgent within 48 hours, or routine within 7 days. Since CJC monitoring report began in March, the number of requests has been now tracked for the first time in the history of the city and documented. So now that we are overseeing it, we can provide you actual data on how that's going, and we have a feedback loop immediately as to why something wasn't seen in the emergent time or urgent time or routine time. So our follow-up and completion rates for all three have stayed high throughout the current contract period, which was different from prior years, and there are no concerns with the actual process. That doesn't mean that inmates don't have their own feelings about how things are being handled. But as for the actual requests, we're able to monitor those. Next slide, please. So this is a snapshot of those times. Again, not just us or the CJC are tracking these. The national entity fly into town, and they sometimes just pop up, sometimes it's scheduled, and they look to see if we are meeting national standards. You can see that we have been in the green for those as well. Next slide, please. I want to address serious inmate events. So at the direction of the Department of Corrections and Department of Health, PCUSA is asked to evaluate each event and produce a report within 24 hours. What do I mean here? So if we get a grievance that goes to the mayor's office, if it goes to the Department of Corrections that says a lawyer, a family member has said that they believe that their loved one hasn't received X, I wanted to review our current process. Again, this process wasn't in place before the last year, but what we've been doing in the last year is the following. Each event, once the report is received, it affords all parties the opportunity to ask follow-up questions. So those activities have become part of a standardized work plan between all of the departments. To put it plainly, we get those reports and we say to PCUSA, I need an interim report on whatever the complaint was within 24 hours. That means that the doctor has to give us their purview, that a member of my team, separate from the doctor, will look at what was in the chart. The commissioner, if we need to, will review video evidence of what is happening or not happening, either in the inmate cell or at medical. And anyone who is involved in care that we need to interview will be interviewed. We get an interim report and then we give them more time, because it's not always easy to put together a complex medical report in 24 hours. But then we give them time to get a final report to us. But that interim report allows my team to say, well, why didn't this happen? Why didn't that happen on this date? And continue to give them feedback. When events involve an inmate death, we do the same thing, but we also hold a debriefing within 24 hours of the event with all stakeholders. Again, those stakeholders include the Department of Corrections, Department of Health, and the healthcare provider. This ensures consistency and collaboration in the evaluation. Next slide, please. So I asked my team to dig up examples of some of the grievances or complaints that we received. I have a lot of detail on each of these events. So, you know, I didn't receive medical care. Nobody changed my dressing for my wound. I'm not receiving my medications are examples of ones that we get frequently, right? According to the investigation that we did before, we now track those, and we always give a report back to the commissioner, who communicates with the patient's family, the lawyer, a judge, whoever comes to us about it. This is a snapshot of the sample size of 7 incidences as examples. And we classified, was the grievance fully true? Whatever you said to the T, we can say with certainty it didn't happen. Of the 7 samples that we drew, 1 was true. 3 were partially true, and 3 were untrue. It's important for me to show you this because it is easy for someone to say a statement, no one gave me my medications, right? Sometimes what they're trying to say is, I'm not getting my medications in a way that I'm used to, or I'm not, but if you say no one has ever given me my medication, and I do this investigation, we can show you indeed did get your medication. Sometimes not as quickly because, again, you can't administer a drug until a medical professional can confirm that this person is on that drug. Take insulin, for example. If we were to just take the memory of a person saying, I take this dose of insulin without any way to verify it, our Hippocratic oath in medicine does not allow us to just start administering medications. When you work in an environment where there are more staff and people that are able to get that information here, sometimes that happens quicker. But even when I had clinics in community, when people would come to my clinic, I could not start saying, I'm writing you a script for X until we verified it. So most of them fall in that partially true. That sure, you can't say you never got the medication or you never got a bandage changed, but you're right, there were times when you should have been transported out of your cell to come see a doctor, and that didn't happen. So those are the things we're now clamping down on. The new commissioner, Ross, has been an amazing partner because I will call her and I will say, listen, I've seen that this transport thing didn't happen, or I've seen that there were in fact 3 out of the 12 times that this person that was seen that they didn't actually get. Can you help me figure that out? Why? She'll pull video, she will review them. A lot of people in the public is like, we want to see every part of every investigation, and you can look this up. HIPAA does not allow me to just publicly give the medical records of someone to the press, right? So where I understand that you have not even known me for a year, that there is no reason you should believe any of the slides I have today, committee or the general public, but that trust has to be earned. We'll continue to do what we need to do to earn that trust. However, by our investigations, a lot of these fall in the partially true or untrue categories. Next slide, please. Let's discuss the trends for deaths in the CJC. So there have been 2 deaths since we have taken over medical oversight and evaluation of the CJC since January of 2024. There were a total, if you look at these, of 19 deaths since 2019, the highest number of deaths occurring on an annual basis being 2022 and 2023 respectively. So you can see from that chart, before we got involved in oversight and evaluation, there were 5 deaths the year before. There were 6 deaths the year before that. From the time we took over, with all of the challenges that were needed to find a new provider, change jail culture, train everybody, find all the resources to fix things, we are down to 2. 2 meets the national average. If you look up the national average for deaths in city jails of similar size, we are now within 1 year within the range of the national average. Again, nothing to celebrate. 1 death is too much. 1 oversight, 1 missed pill is too much. But we are making strides. We are making improvement, and we want to continue this trend. There have been 13 non-fatal overdoses since January. The overdose rates at CJC declined mid-year, with only 2 since June. So a lot of those interventions I described earlier are showing a decrease. Is it perfect yet? Absolutely not. Am I happy with it? Absolutely not. But do we need to call out the fact that we are making improvements? Yes, we do. According to the United States Department of Justice, overdose rates in city jails have increased by 211% across the country since 2019 and are the #1 cause of death in the country. It's also estimated that 30 to 50% of detainees suffer from some sort of drug dependency. CJC has been consistently trending the opposite way since we took over oversight and evaluation, with the number of overdoses decreasing. I also want to say that if any of you have had the unfortunate understanding of how complex a drug addiction and mental health is, that is a hard thing to get a handle of and to deal with at home or in the best hospitals. A jail is not an environment that is a place where you can have an expectation that that is going to suddenly and miraculously go away. But we cannot be responsible for that taking a backward trend. To hear that in a year where the national trend was 211% increase, that we are making improvement, is another thing to say, let's keep up that. Let's keep improving, but let's keep up that. So in an effort to continue reducing the number of non-fatal overdoses, the Department of Health, specifically my Behavioral Health Bureau, has been training correctional officers on mental health. We've done trainings on crisis response. We've included Narcan training. All cadets who have arrived since June 2023 are now trained for the first time ever and supplied with Narcan kits that can also be attached to the utility belts. The same kits or pouches have been supplied to all the correctional officers. 2025 annual training with the correctional officers starts on February 3rd, 2025, and will conclude by the end of March. Next slide, please. So, there's a lot that goes into the downward trend that you're seeing in deaths and overdose. We take a proactive and transparent approach to how care is delivered. We, as previously cited, those serious events have now a process for evaluation. We hold people accountable. There are people that we have hired that have gotten disciplinary action. There are people that no longer work there because accountability is something we're now holding key. In addition, the healthcare provider conducts an intake screening for all detainees. This presents now a prime opportunity to identify individuals who are suffering from substance abuse or mental health. Having this information and being able to do an evidence-based detox and mental health protocols is critical for the immediate and future treatment provided to these inmates. Taking this a step further, the healthcare provider placed a mental health professional in the intake area, also the first time ever, and having had that person involved from the start helps facilitate a safer and more optimal care delivery. For overdoses, the vision of that holistic healing that our Bureau has is something that we're trying to implement and train. As part of that vision, the Narcan linkage to care and outreach, education and training, and we've also started coalition building with partners who are more trusted messengers. Because again, we know that there's valid mistrust for government. We know that there's valid mistrust for even like myself. I know I have to earn that trust. So what do we do in the meantime is try to bring in partners who are trusted messengers, and we're also working on that. So those focus areas have led to over 2,280 linkage to care calls in the community, over 14,000 doses of Narcan, participation in the community, participation in over 200 outreach events. It's important to note what we're doing in community, because if we're impacting folks in community, it impacts how they show up when they come to. Next slide, please. Other care delivery improvements since we've taken over, we have developed protocols for detox and suicide prevention. We've updated evidence-based protocols. There were no SOPs or standard operating procedures. We've developed those and trained people. In addition, after discussion with the Department of Correction and Department of Health, the healthcare provider placed a mental health professional in intake, like we said previously. We also partnered with DOC to do focused mental health resources for inmates, including assessments, therapy, and adjustments to their medication regimen. We went into partnership within the last year with the Department of Mental Health, so they come in and do additional screenings, additional recommendations. So you now have the state entity for mental health coming in for the first time, and they provide recommendations for our inmates as well. Next slide, please. We're almost there, folks. So again, I want you to keep top of mind what is the overall things that have gone into to address mental health and substance. That partnership with the national entity, NCCHC, them coming in person, them giving an unbiased and separate report, them giving an unbiased and separate feedback, the corrective action plan that is between corrections, PCUSA, and health, living, breathing document, deadlines. You're gonna see a example of that in just a second. The priorities for quality improvement that my department prioritized, all the trainings, and then the new detox program. Next slide. I'm not going to stay on this one, just though there's a lot of training modules. If you'd like a list of all the trainings that have happened since we're over, I can make that available to you. And this is my last slide. This is a snapshot. Next slide, please. This is a snapshot of what the corrective action plan looks like. Well, it looks really small from the people in the room. It is, like I said, a living, breathing document of over 30 improvements that we are holding PCUSA accountable from the site visits that the national entity made. The columns talk about what the issue is, the action is. We outline the responsible party. In red, if there's more than one responsible party, we say the person we're holding responsible for this is the person in red. A date by which they need to make those changes. We cite what metric, so why are we telling you to do this? Because this is the standard. We talk about reporting frequency. We have update notes so that everybody is talking to each other in this document. This is obviously supplemented by also in-person notes. So I'll end by saying that I hope the message that you received today is not that I'm in any way happy with where we are. It was a lot and very hard to see the state, some of the medical care and overall medical care was in before I took over. But my job is I can't afford to be paralyzed and stay there. I'm very proud of the work that we've done with the Department of Health. I'm very proud of the partnership with DOC. The commissioner can tell you when she comes up, it's not always easy. We don't always agree. But at the end of the day, we have the same priority, which is to have a forward momentum. Almost every metric that you saw from prior years has been improved significantly, and this has been validated by our national partners. I will stop here and happy to take any questions. And I'm also available to stay later if we need more time for questions.
Thank you, Dr. Mahdi. At this point, I'll open it up to the committee. I have a few questions, but I know that there are people who have been champing at the bit to get this hearing, so I want to make sure that they have the opportunity to answer their questions and try and respect your time here. So with that, I'll go down the list. Alderman Oldenburg, any questions?
I have no questions, Chairman.
All right. Let's see. Alderwoman Clark Hubbard.
Thank you, Mr. Chairman, members of the committee. Thank you, Dr. Mahdi, for being here today for this presentation. I'm still going back over some of the things you said, so I may have some questions later. I also want to thank the public that got us to where we are here today. The calling out, the advocacy that was done, we wouldn't be here today if not for that. So I want to uplift and elevate that. Again, I'm going to go back over some things that I flagged when you were speaking, and you may answer them in question and answers upcoming. But again, I do want to acknowledge and uplift all the work that got here today. I want to acknowledge and uplift the unjust suffering and outcomes that also were suffered in this work. So again, thank you, and I'll be looking forward to the rest of the presentation and hearing from the public.
Thank you.
Alderwoman Keys.
Thank you so much, Mr. Chair. Dr. Mahdi, you know, I am a tremendous fan, and, you know, I was very impressed that despite the time constraints, you have once again risen to the occasion. As you stated, one death is one death too many.
That's
And
right.
we are certainly very sorry for the loss of life and the hardships that it has placed on our community as a whole. So I'm impressed with everything that you guys are doing, and I am very confident in your ability and in your work. And so I thank you so much.
Thank you, Alderwoman.
Thank you, Alderwoman. We'll move to Alderwoman Sonier.
Hi, Dr. Mahdi.
Hey, Alderwoman.
You know, I'm going to start by saying, you know, thank you for coming, but especially I'm really appreciative of the data. I really do like these charts and these numbers, and I think this would be, you know, great for us to see this. I think it helps, for me, it helps me to understand in real time kind of some of the immediate impacts that are happening as more things get integrated and implemented. And I also think it allows for us to you know, are we making the right decisions with the contracts we're going in and how it's coming in? So I haven't had time to look through all of the incidents yet, but I just want to start by just first thanking that I think that even collecting this data and presenting this data is a first step. Are we supposed to just keep our questions specific to you right now, or okay? I see that there isn't a specific time frame name for the mental health assessments or evaluations, but there is ones for other ones. Is there a time frame that we try to get to that within?
Yes, so there are national standards for include them into the mental health presentation today. I can ask Bo to, all of the follow-up questions that we have that I don't have right before me, Bo can take notes and we'll send you what the national standards for those are.
Thank you.
Sometimes NCCHC will say there is no actual national standard, but not for some as prominent as mental health. But it depends on, mental health is a broad topic, so it depends on what you're asking specifically. So we'll try to compile a list of the different things we are tracking and the amount of time provided by the national accrediting body, and we can make that available.
Thank you. And on the same page of mental health, I know we've had some deaths that were directly connected to suicide. So my question is around, and I know we've gotten a psychiatrist that has come in, so I'm trying to, you know, specific to the suicide, I did have a question I didn't ask last time. Have we been doing mental health evaluations all along, but we didn't have a psychiatrist, so it was slow? Or have we just really started with the mental health evaluations now that we have a psychiatrist? Just wondering the connection there.
I believe there were always mental health specialists under the prior contractor, but I cannot speak what happened before. Health was never included. The mayor and I were both shocked when she took over and I took over. I've never seen a situation where the city has medical file and the director of health and the Department of Health have zero involvement. So I will be honest with you, this was an emergency when I took over, so I didn't have time to do a historical deep dive into what they were doing and why. My business was to address the now and to deal with the now, right? I haven't even been able to touch things like wellness and nutrition because I'm dealing with 6 people died the year before I took over. 5 people died the year before that. I'm just trying to stop deaths, first of all. Then I'm trying to make sure we are addressing foundational practices, and then I can add the other thing. Is that sufficient? No. There are many a night where my husband was just like, you're not gonna make it through this, because it is devastating as a physician to know that you are doing it in that kind of piecemeal fashion. But the only way we were able to do the improvements was to prioritize what needed to stop and work down that list, right? So I don't really know what their approach was historically, except to say they had mental health provider. As for me and my oversight and evaluation, we have a psychiatrist. We have more mental health providers now than they've had before. The challenge is learning, right? When you hire any new person at any job, it's not like they hit the ground running. So I'm really happy to see now the shift in culture that's beginning, people beginning to learn each other, because it's really hard to see the kind of outcomes we all want when people are new and when we're doing so many new things. Any person who leads in any department will tell you that if you give people 50 new things to do at once, it's overwhelming. So even though we have an urgency, and I'm sure even the advocates in the room have a laundry list of things that they would want us to deal with, the hard job that, and again, it's not like woe is me, hard job, I mean just the challenge is to say, if I tell people to do these 30 things at once, you can actually create a situation where we get 30 Bs instead of 4 solid As and continue to go down the list, right? So that's kind of been, in simple terms, our approach.
Thank you. And the two, I know it says in 2024 there's been 2 deaths. Were those suicides, or do you know what this homicide, suicide?
I'm never going to say on record exactly what the autopsy report had. I can provide that to you in the way that the ME allows me to, because again, HIPAA does not allow me to make people's medical histories public even after their death. That is a HIPAA violation. But I will get whatever information the ME allows me to say. I know the data shows, like, we attributed a death to this category and that category. Bo, you could even look it up while we're in here, because I think we have that in one of our reports, or we will send it to you.
Okay, so you're saying you'll figure it out.
But to clarify, and after a death happens, we have to wait for the ME's final report. So any report about the cause of death, and sometimes they can't say the cause of death, so they'll say the presumed cause of death comes from the medical examiner. I beg your pardon.
No worries. Yeah, I would be curious in that, because I know, again, I don't know what the new trends are, but I know for a while we were having instances where a lot of detainees were committing, it was instances of suicide. And now that we have the, psychiatrists and we've switched providers, I would love for us to be actively tracking, are we seeing, improvements? And I would also, I know you can't reveal personal information, but I would also be curious if it's suicides, what was their method? I know sometimes within facilities, people get really obviously innovative. They don't have much available to
That's
them.
right.
So I would be curious about what are the methods being used for those suicides, and definitely would like to know more about the connection between that. And I guess, I don't know if you can speak to this.
And I want to be clear, I can only speak to medical. Anything outside of medical, whether it's conditions or how someone did something, is in the purview of the Department of Corrections. So those questions have to be separated out, right? So I would ask, I can answer the question around cause of death that is publicly available information, but I can't answer the death about what's happening in people's cells and whatnot. That's not a medical.
Yes. And then last time that we came, we had a hearing, we discussed this, and you had just started and you were talking about a medical wait list that you found that was in place, and I was wanting an update on
Thank you, that's a great question. So we inherited not just the devastating situations around medical, but there was a backlog of services that the prior provider had amassed. So this new emergency provider was tasked with starting in 2 months, like coming across the country to start every single thing that I've described here in 2 months, recruiting the entire team in 2 months, and then addressing the backlog that the prior provider had created, right? So you can imagine that in an environment where we are not a WashU, in an environment where there was devastating conditions and still are in some areas in medical care, and then on top of that had a backlog of cases, it makes it really hard to do what you need to do. They have made significant progress. We gave them deadlines by which we need you to catch up with this many backlog by this date, this many this date. After a bidirectional conversation about, if I tell you to do too much backlog, then we're going to continue to get complaints about people not receiving health care now. So I had to find a balance between, you need to see people, and we already have problems with people not being seen and not being seen in the way they feel they deserve. So how much time should I be asking you to allocate to catching up with backlog? So that's why we use the NCCHC. One thing about it is, if I'm not the expert at something, I'm gonna bring the expert in. It's very irresponsible for me to guesstimate how to do things. So the experts helped us come up with an algorithm. That corrective action plan I showed you at the end is one of those where we need this done by this date, and they have been meeting all of those backlogs. Have we caught up completely yet? No. But can you add to your list an update on exactly how much we've done for the backlog? We'll get you those numbers.
Thank you. And I used to work in mental health, so I know this question is why I'm curious. But how does detoxification, that was service was specifically mentioned, how does that work within the CJC? If someone comes in, they're addicted to a substance, they're going through active withdrawal, I'm assuming I know you guys have like a private area. Does that mean they just wait it out in a private area? I'm just curious about how that's going.
So I would dishonor detoxification. That's a whole topic in medicine that people train people over semesters. But very simplistically, you have to think about an area that's appropriate for people to detox. You need to think about the people there. You need to think about when someone is detoxing, even in a hospital. So when I used to be in internal medicine, if somebody came in and they were on detox and I was on call, that meant that the nurse that was seeing that person had to come get their vital signs a lot more frequently than other people. There's a whole list of things that they had to check to make sure that they were still in a healthy place. So the challenge with detox is that in a jail that is already not an optimum environment to do healthcare, in a jail that is not fully staffed in the way a hospital is or a mental health facility is, to do detox means you're asking the staff to do even more frequent checks and even more oversight, right? So we had to find a balance between the level of detox we could do for people in the jail and then when it is more responsible to send them out to the hospital for greater detox supervision.
So you're saying it kind of probably depends on how.
It's so many things that go into
factors.
it. What are you addicted to? How addicted to it are you? How bad is your detox process? What other medical conditions do you have that we also have to co-look at? Do we have the number of nurses available to do the detox? Not all nurses are qualified to do detox criteria. How many other inmates do we have at the same time? If we are well below jail census, we probably can have more people detoxing. If we are overcrowded in the jail, we cannot do detox processing. That's just a little bit of a dent into the considerations for detox.
And I would imagine, I know this was a hospital setting, so it's different, but we used to have time periods where someone would have to be able to be guaranteed kind of after supervision, or they would have to go to critical care. So I'm sure that that's somewhere within.
That's also part of the criteria. So the medical director and their team have to make a really responsible decision about, can this person stay and get the adequate health care they need in CJC with all the other things going on at the jail, or do they need to send them out? I'm sorry.
Okay, I think those are all of my questions for you. And to help, I will send you an email with what I asked you with the specific questions. Thank you.
All right, thank you, Alderwoman. Vice Chair Aldridge.
Thank you, Mr. Chair, members of the committee. I won't be too long because I know we got other folks in also the community. I just want to thank you, Dr. Mahdi, for being here and kind of speaking on the health element. Like you said, there's two parts that the jails where questions can arise is kind of on the health. And I think the day-to-day operations of how things are going in the jail. It sounds like, as Alderwoman Clark Hubbard said, if it wasn't for the community organizing after these countless situations, maybe you wouldn't have been in the position where you were. I think the outcry of the community really is the reason why we had to bring an expert like you. And I'm glad you are doing the work that you are in the jail, because I know just working with you, there's a long way that we still got to go in the jail. I think you acknowledge that. You said that it's a lot of stuff that we still need to address and actually put systems in place to make sure that the jail's not a place of, I always say, not a luxury, but it's not inhumane. But
exactly,
I have not seen, since I've been down at the board, it is our second year, when we've had conversations with the jail public safety director, anybody, the former leadership that was over the jail, I haven't seen I see a plan here. I see a start and a finish, or at least not a finish, a start, and how we can continue to move on the progress. And I think that is very helpful, because a lot of times as alders, what we're also saying is, how can we help? Because we get phone calls on these situations and stuff going on at the jail too. And even though it may be frustrating, it's also, how do we make sure we don't want to see another loved one, ours or not, or a friend or a community, die at the jail, get hurt at the jail, if it's inmates or staff. So I just want to say, thank you for your leadership. I think it's critical that you're here, because when we are having these conversations about the jail, and how your department is now working in the jail to kind of change some of the things that have going on, at least on the health side. Not a day-to-day operations is still a lot of questions, and I think that's why we're having this committee hearing. But at least on the health side, look like there's been some progress, and we still got some way to go. And again, I appreciate and look forward to getting more of these, and the transparency and accountability that you are also taking today and saying, yes, we got to do more. You're gonna do more, and kind of having a focus, because you could have started anywhere, but you have, sounds like you're trying to focus in an area, and I'm sure if you have more staff, you can focus even more. So I know that you kind of got put in this situation because the former contract got canceled and we had to do an emergency contract. Is now the health department going to be like officially part of helping? Before the previous contractor was canceled, was there any involvement with the health department in the jail? Zero.
Before the mayor called me on, the health director, me,
Yes.
the Department of Health, was not involved in any part of medical care in CJC.
Got it.
October of 2023, we have for the first time had involvement. And once again, we are not providing direct medical services. Once again, we do not have the final decision making, but we provide oversight, evaluations, and recommendations at the discretion of the commissioner and the director of public safety.
And now that's an ongoing thing. So this isn't just like a 8-month, 10-month, 1-year trial. This is
I serve at the pleasure of, so as of now, yes. that is
yes.
the plan.
Gotcha. Of what we can speak on. Yes, gotcha. Okay. And the emergency contract of the new provider, are they still intact? Are they, I don't know if that was like a 2-year, 3.
Emergency contract was only for 1 year, and so we're in contract negotiations. We put out an RFP at the beginning of the year. We only had 3 people respond to that RFP. We did national postings of it, reached out to people. People don't want this business for some of the reasons that were described here today. People really, it's hard to get people to want to sign on, especially to sign on when they see what had been happening historically. And so we are in current negotiations for the long-term contract.
Okay. Thank you for your leadership. I appreciate you being here, Dr. Mahdi.
Appreciate you.
All right. Thank you, Dr. Mahdi, for your time here, and I also want to thank you for your attitude towards this and being very clear that the people inside CJC are our community members, our family members, our neighbors. Virtually everyone that's in there will be coming out of there at some point, and the way that we treat them while they're incarcerated determines the way that they will look at society when they have paid their dues to society. I know that you had indicated that you had inherited a pretty rough situation. Is the new provider making that situation more attainable? Is it something that you're continuing to work through with the new provider?
Yes, I would hope the presentation today would show like that. Almost every metric that the National Entity for Accrediting Medical Care has tasked us with meeting the standards of, they have met or are rapidly meeting those criteria. As far as communication, they communicate directly with us. They could easily take the attitude of, why do I have to listen to you? I have a contract with the jail. They don't do that. They work closely with my team. They take feedback. They are always available when I call. At the end of the day, a human being is not a number, though, Alderman. So, my job is to come and show you the facts that I have. But again, the attitude I have is, what if someone in my family, what if my husband was pulled over and something happened and he was in CJC? What if one of my kids, God forbid? I've received the calls from people whose family members are in there. I have had people that I have known circumferentially. This is my community. This ain't separate from me. This is my community. I don't have to have this job. I could have quit and taken another job or other job offers, but this is my community. And so people are not numbers. There is way more that needs to happen. There is way more context than what is in there. And so for Alderwoman Hubbard to shine a light on the people that brought us here, to push us all to do better and be better, I receive that, right? But people are not numbers.
I appreciate that. I guess the kind of a follow-up question is something you said. You had indicated, and the example that you had put forward was insulin, that you can't, and I understand that you can't just go off of someone's memory of dosage of medication or anything like, um, or else my guess is that you guys would be handing out certain pills over and over because everyone who came into your facility would have been prescribed them. Um, but how do you control for that with things like insulin,
Yeah.
asthma, heart pills, things that have a kind of an immediate and acute response where if someone goes without their medication, even
Yep.
for a short period of time, that it could be they could put them in a bad situation.
This is one of the most serious issues that we inherited. I remember getting grief parents being like, my son said he didn't get medication. I did investigate. They got some of it, but not all of it. There are medications for which some, but not all, is not sufficient. So we did a deep dive into the problem, and the problem is the United States healthcare system is broken. There isn't even a uniform electronic medical record. What does that mean? That means the electronic medical record that they use in the jail is different from WashU's, different from CVS's, is different from SLU's, is different from. So to even verify, in Canada, if you go to the jail here and you say, I took insulin, their electronic medical record system connects to all people who do healthcare. So you can verify it. It is a failure of this country, right? And so we have to do this absolutely ridiculous protocol of depending on phone call, faxes, different rules at CVS versus WashU. If you get a person with an attitude at their medical records and they tell you, no, I'm not going to tell you a quick thing that I see in my computer, but you didn't sign the form correctly, right? And then taking accountability for the staff in medical care. At the end of the day, the counterpoint to this is we pay these people a lot of money to deliver healthcare. So I'm going to need you to figure it out and figure it out quickly. So once we started getting these grievances and doing that serious events, and I'm seeing, because I'm a doctor, at the end of the day, this is what I do. I'm looking, I have a team under Bo whose entire job is to just pick random charts and just look through them. I have to review them because I'm the doctor, and I'm like, nope, that won't work, right? And so what I like about PCS USA is I don't sit at them at the meeting and they argue back with me. I sit with them at a meeting and they're like, man, we need to figure this out too. They tell me the real about the challenges, but the counterpoint is we pay you a lot of money to do this. So we hold them accountable. So what have we done? All of those interventions at intake, increasing people who do this job, hiring people who have to call CVS and keep hounding them, right? And holding people accountable. When any of the partialies or trues, you better believe, just like at any job, that staff member is brought in. And like I said, there are people who no longer work here, people who got disciplinary action for things that happen, right? So it is a balance. I'm not saying that I'm happy with the level of medical reconciliation, but I'm saying that if we want to spin a narrative that St. Louis is doing something that is happening nowhere else, and that St. Louis isn't doing something that is easily done, that is also not true. So, is it what a mother of a son who needs his insulin today wants to hear? No. If my child was in a jail and needed his insulin, you best believe I wouldn't give a damn what a lady in a yellow jumper had to say on a random Thursday, right? But at the end of the day, this country has absolutely failed communities, and disproportionately Black and brown communities who suffer healthcare disparities, which is why when I say that's my community, let me be abundantly clear, it is my Black community in the jails. But if you think I can undo something that the country hasn't figured out, then go ahead and, you know what I mean, hold me accountable in your way. I cannot control that. So I pay these people a lot of money. They need to figure it out. And they don't have the easy access that other countries have to resolve this issue.
No, and I hope that you don't.
This isn't you. This is me finally
here.
being able to get some of my frustration out, but you asked a great question.
So if I got arrested today,
Yep.
And ended up in the jail, how long before I would have my say I was an asthmatic, how long before I would have access to the asthma meds that I would need so that I didn't have a asthma attack and so on and so forth?
I would love to be able to give you guys one-size-fits-all answers. It depends on how many medications you're on. It depends on if you're on a multivitamin, I don't care if you don't remember it right. It's not going to kill you. But if you're taking, a very serious medication, I have to do due diligence to make sure I got it right. It depends on, have you been in our healthcare system before so it's easy to find your medical records, or are you a offender? It depends on, do you arrive to CJC of right mind, or are you not in the position mentally to do that? It depends on, sometimes those folks don't want to talk to medical because of some of the things they've experienced en route in transport by somebody else that doesn't have anything to do with medical, right? I've had people come to my office and say, I don't want to talk to you though I'm here. And if I really understand the root cause of that, it is because they have valid mistrust. So there's so many components that go in. We can easily start some medicines. We can easily get callbacks about some things. Sometimes we don't. The easiest example is if they come straight from the hospital back to the CJC facility, we have now created better communication tools to really get clear handoff, right? So that whatever they were getting when they were in the hospital, if it's appropriate for us to give in the jails, we can do that then. But it has a wide variation. I promise you I'm not an excuse-driven person, but I will never lie, right, at a hearing to tell you that I have one answer to answer that question about if I were to show up, how would it be? It depends on a myriad of things. Once again, I'm still holding PCUSA accountable, and they are rising to the challenge of, you get a grip of money, this is a job at the end of the day, so we've got to see results.
I appreciate that, and that really ends my questions. Does anyone from the committee have any follow-ups? Please proceed, Alderwoman.
It's going to be really quick, I promise. But when the commissioner gets up, I'm going to ask questions about like their programming, their day to day. And I know that typically people are going to say, well, that's operations, that's not medical. But I just want to say this to you because while we're talking about the mental health of the detainees, I think that our ability to make sure that they have access to some kind of programming, especially given how long they're there, or our ability to make sure that they're somehow getting outside, that they're not held in spaces for a certain amount of times. I think like we should look at our approach to all these things as not just criminal justice efforts, but public health efforts.
Mhm.
And so I'm really just putting this comment on the record to say I'm going to do my job as, you know, the alderwoman to hopefully do the advocacy to encourage us to get there. But I just, as we continue to focus in on mental health services and medical services and what that looks like, I think it's important that, and I think the people who are given the mental health services will see that in a special way, that that connection between those things are there.
I agree too.
Thank you.
Thank you.
Thank you, Dr. Mahdi. And I guess with that, we can move to the next part of the presentation.
Are we moving on to the operational review portion? That's what do you have a presentation?
However they would like to do it.
No, we don't have, you have a presentation.
No, okay,
Presentation, and you should have it,
okay.
but I don't personally. Okay. Good afternoon, Mr. Chairman, Mr. Vice Chairman, and the board. Thank you for having me. My name is Charles Coyle. I'm the Director of Public Safety. Can you hear me well? Okay.
Yes, we can.
Great. Before I start, I wanted to introduce you all to the new Commissioner of Civilian Oversight. This is the first opportunity, I think, that many of you have had an opportunity to meet her. She's just come on board last month. So, and she's actually been doing some good work with civilian oversight. So this is Dr. Barbara Milan, who's the new Commissioner of Oversight.
Thank you, Director Cole. Good afternoon to Chairman Naran and the members of the committee. I am very pleased to be your new commissioner. I previously was working for the city's Community Development Administration, and I'm very happy to be working with the Civilian Oversight Board. You are going to be able to see in the very near future more information about what has transpired in terms of allegations, in terms of the investigations, and we are seeking to also provide the information about cases that are closed. So I won't go into detail about that because I'm still fact-finding, as well as my learning curve is pretty high as well. But I come to you with the background of having worked with police departments in the city of Cincinnati and also in Minneapolis, Minnesota, as well as working with community people to support positive relationships and partnerships where the community people and the police officers are working together. We have one common goal, and that goal is the safety of the community. So thank you for the opportunity to meet you on today. I will be following up to meet with you individually so that we may have further conversation. Thank you, Director Cole.
Thank you, Chairman and the board, for allowing me to do that. I brought with me today is the new acting commissioner of the corrections, and I know you want to hear from her. We've actually begun an assessment of CJC, and I brought with me Doug Burrs, who's the owner of Criminal Justice Solutions, LLC, that has been doing an assessment of the jail to kind of help us figure out what things need to be done. So with that, let me start. Under the leadership of Mayor Jones, several changes have been implemented in strengthening our strategic approach to public safety as it relates to the operations of the city jail. Number one, MSI was closed. Two, the Detention Facility Oversight Board was established. A new healthcare provider, PCUSA, was selected. The Department of Health became involved in healthcare oversight at the facility. Let me pause right there for just a second. Prior to that, we had a commissioner speaking with medical about medical issues. So bringing in the health department was a big advantage. We had people that understood medical and health issues now dealing with the providers to do that. Number five, bonuses were provided and put in place to encourage recruitment and retention of correctional staff. These changes were vital to positioning us to deal with the quality of life, safety and security, infrastructure, and continuous improvements in care for the continuity long term. Over the past decade, there have been a number of deaths in the city jail. The majority of these deaths, as determined by the medical examiner, were attributed to three major causes: medical concerns, medical problems, drug overdose, and suicide. Medical problems was the largest percentage of those deaths. I can say that under this administration, we have put our efforts in dismantling these crises by addressing the root cause of each situation. Under medical, we've worked to secure a new healthcare provider, Physicians Correctional USA, to assure that detainees receive high-quality medical care. In addition, allocated $2.5 million toward oversight, ensuring that we meet the standard of the National Commission of Correctionals and Healthcare. As you heard from Dr. Mahdi, progress in medical care has been made, and we are trending in the right direction. We've also seen significant improvements in identifying and addressing mental health, lowering the number of suicide attempts. Acting Commissioner Tammy Rouse will provide those numbers during her segment of the presentation. Under drug overdose, we combated the entrance of contraband in the facility through collaborative efforts with SLMPD, narcotics detection dogs, and the K9 unit, and conducted routine drug sweeps. We've purchased additional Tech 84 body scanner technology, and corrections administrators have begun terminating correctional officers in violation of the contraband policy. Since its inception, the City Justice Center, particularly the Division of Corrections, has been in the forefront for many. It is a vital part of the administration's reimagination of public safety. It's at times the leading headline of local news, and it's a daily concern on the hearts and minds of those individuals within our community who have loved ones who are in their awaiting trial. It is understandable why the city's Justice Center and its operations is a top priority, and it's those very reasons why we continue to work toward the improvement of the conditions and care of those residing and working within the facility. The Department of Public Safety and the Division of Corrections are committed to continuous improvement. In alignment with that goal, we recently brought on Doug Burris, who you will hear from, with Criminal Justice Solutions LLC as a consultant to evaluate and provide recommendations that will align our facility with national best practices. Accessibility is available to the Division of Civilian Oversight and the Detention Facility Oversight Board per the Ordinance 71749. Investigators have made contact with legal representation of the complainants in order to request permission to interview their clients. This step is necessary to ensure the protection of constitutional rights. In cases where interviews cannot be secured, investigators have been directed to proceed with all available investigative measures. After an exhaustive search, we are pleased to announce the new onboarding of Dr. Barbara Milan as a new Civilian Oversight Commissioner. Training began with the new members of the DFOB on October 28, 2024, and we had 4 additional training sessions in mid-November. We will continue training every Monday until completion in January 2025. While we will not comment on personnel-related issues, as restricted by both the charter and ordinances, Jennifer Clemens Abdullah is no longer running the facility, and Acting Commissioner Tammy Ross, who has 23 years of correctional experience in the St. Louis, is currently filling that position on an emergency basis. At this time, I turn the Department of Public Safety's portion over to Acting Commissioner Tammy Ross to provide updates within the Division of Corrections, unless you have questions for me. I'm sorry.
Mr. Chairman, I had questions, but I don't think you can see me.
Oh, then please proceed, Alderman.
Unless, okay, well, I'll go. Thank you, Director, for being here. And thank you for making yourself and your team accessible to having this conversation. As the Director of Public Safety, you are over to some, you have input over the jail, correct?
Yes.
You are the chief operator outside of probably the commissioner of the jail as a public safety director, correct? I won't say chief operator, but you're over the commissioner of the jail.
I'm the appointing authority for the commissioner.
Got you. I think a lot of times when it comes to the jail, there's been a lot of at the commissioner, and we're not going to ask questions about Jennifer Clemens Abdullah because, well, I'm not going to say we not. I think that how that all played out and Justice Alders, us not knowing kind of the what was going on in that situation made it difficult for when folks was, asking us of what the situation or what was going on. Definitely understand it was a personnel matter. But clearly there's been, I would say, smoke at the jail for a while. And some of these things have been going on way before this administration. The mayor's administration got in and, overhauling a jail is probably not easy. So I'm not here to point fingers. But I think the buck also doesn't just necessarily stop with the commissioner. There are some, as the public safety director, I'm curious of what corrective actions since your time have you made in the jail? And one of them is, I want to ask, there recently was an audit done by the auditor of the jail. Are you aware of that?
An audit done by an auditor of the jail?
The audit that was done by the state auditor of the jail?
Oh, the state auditor.
Yes, the state of Missouri, the auditor that is.
The auditor did do an audit, yes.
Yes, are you aware of that?
Yes, I am.
Have you read that?
Yes.
Out of that audit, do you have like any takeaways of corrective actions?
I think the recommendations from that audit we had been addressing. Even when I did a press conference and I was asked that question, And I hadn't seen it recently, but in my responses, we had dealt with many of the things that the auditor talked about in their investigation. And I don't have everything in front of me, but we had begun the process of doing some of the very things that the auditor recommended.
Got it. Programming, how much of input do you have in that?
In programming, that's really going to be the commissioner, but I can try to influence it. So let me say what we've been working on, right? And it has been a long process since I've been there. One is understanding what goes on in the jail. So I have sent people into that jail unannounced for some time because I would hear stories, but I just can't hear the story and react on it. I have had an investigation take place within the facility where we interviewed employees and others to determine what's taken place. And we've taken action on those. A number of things that we have done, especially with staffing that have crossed the line, we've made them accountable for it.
Has there been new staff hired? I know that was one of the concerns. And has there been new staff hired? I know that was one of the concerns in the audit of the lack of staff that we have. And to be clear, lack of staff throughout all city departments. But
there has been new staff hired, and we're still interviewing for staff. But one of the things that we have to do is change the culture inside the facility. And this is what the investigation we did told us, that we need to begin to change the culture.
Can you speak more to the mic?
We began to change the culture. We recognized that we needed to change the culture of the facility. This is one of the reasons we brought in Criminal Justice Solutions to help us understand that, to help us understand some of the changes in the facility that we need to make. And it's not something we just started with. We have been working with this for some time. As you have witnessed over the last year, it has been very quiet in the jail. It has not been in the news. We did have the unfortunate case of the 2 deaths that occurred, which are still under investigation, but they were not in the line with the 3 causes I gave you. And we're still working with those things. And so, and we admit that those are disheartening, and we need to try to make sure things like that don't happen. I think one person had only been in the facility 9 days. Okay? Yeah. So those are the things we're doing. Programming is that we're working, and you'll hear from Doug Burris, on types of programming that we're looking to try to get into the facility.
Okay. Yeah, because
so I want to make sure you understood some of the things that we are doing.
Yeah, I understand, and I
not acknowledge that there are problems.
Gotcha. And I think we when I asked about programming, and so that I'm clear, and like you said, I understand, I was curious, and if maybe you're not the right one, maybe it's a commissioner to figure out what programming do we have, because I know there's been a conversation that me and the alderman from the 4th have had. Unfortunately, the CJC doesn't have a place for the individuals to like go out and do recreation or whatnot. And when I look at St. Louis County, I think just this past week, their women sale or their women pod had musicians come in, and they were changing some rooms into classrooms where they can be able to play piano. There, St. Louis County has had trainings for their male inmates to get their barber license. But, I've heard that as of recently, in recent years, a lot of individuals that used to come into the jail to talk to inmates or to do some of these programmings have stopped. So that's why I think, as the alderman said, ultimately we want to rehabilitate individuals, and we want to make sure when they do come out, because they're not, they haven't been charged with anything until they go to court. What are we doing to kind of help them to not continue to create that revolving door and cycle of when they get out? So my question is, what programs do we have now in the jail for our inmates? And if you...
Go ahead. Sorry.
I'm done.
Okay. The acting commissioner can address programming in the jail. But what we are doing is working with the Office of Violence Prevention that deals with release before detainees are released to kind of help them get on board. Again, this is why we
When you say help them get on board,
help them adjust when they're being released from the detention facility.
does that mean like employment? Does that mean like,
It means they have a spectrum, they have specialists or clinicians that speak with them about those things. They see individuals before they come out to help them really get back into the mainstream of life if they can. So I know that Office of Violence Prevention has that in their toolbox with their employees. They do what's called reentry.
okay, maybe I'll wait for the commissioner because maybe she'll be aware. I'm still not hearing those substantive like programs.
I understand exactly what you want. Or do they have training programs? Do they have?
No, the answer is just like, I don't think clearly you do understand what I want. That's what I'm asking. I think I'm trying to figure out what programs do you have in there, and I think you said the acting commissioner can speak on it. I hear about Office of Violence Prevention, but again, I'm not hearing like, Slate is, coming in on Thursdays to, as like you say, also tied to that to maybe help folks get out, or we're working with, I don't know, a Christian group that comes in on Tuesdays. That's what I'm asking, like what actual programs do we have in the city of St. Louis that we're partnering with for individuals in the jail?
Yeah, I think the acting commissioner, as well as Mr. Barris, can address that. We've talked about the involvement of Slate and the things that Slate can come in for employment with. So I think both of them will cover that, probably sufficient for you, hopefully.
Thank you.
Okay. Any other questions?
I'm done, Mr. Chair.
Okay.
All right. Then with that, we'll move.
Chairman,
move forward.
Sorry, I'm not sure if my questions are better suited for the director or for the new commissioner, so I can just wait on both of them until the commissioner comes. Okay.
Thank you.
Okay. Yeah. Well, then, yeah, we'll just hear from the commissioner, and then we'll circle back with any further questions.
Good afternoon, Board of Aldermen, women, everyone here and those who are watching. I am Tammy Ross, Acting Commissioner of Corrections. As a homegrown professional with the 22 years of dedicated years of service to the Division of Corrections, I bring experience and a deep understanding of the department's operations and missions. Throughout my career, I have worked directly with every facet of the division, gaining comprehensive insight into the administrative and operational functions. As acting commissioner, I remain committed to advancing the division's mission, fostering collaborations, and ensuring the safety and well-being of staff, detainees, and the committee we serve. I have a slide.
We were trying to figure out which presentation belongs. We have several for you guys. We didn't know which one was for you next. I do believe it may be.
Thank you. The mission of the Division of Corrections is to ensure a secure, humane, and professional environment for detainees who are awaiting trial while in our custody. These individuals remain in our custody for two reasons. Either they are unable to post bond or they are held without bond, regardless of their charge, conviction, or matters related to their case. It is the advantage point of all who lead or work
at the City Justice Center to ensure their safety and security. As of today, January 16th, there are 778 detainees in custody. Of the 778, 8% are females, 92% are males, 84% of our population are Black, 16% are white. The largest percentage of our population are within the age range of 18 to 24 years. One is under the age of 18, and the 29 detainees are 60 or older. In order to maintain our commitment to upholding the highest standard of integrity, respect, and fairness of all detainees within our custody, the Division of Corrections is committed to continuous improvement. There have been multiple evaluations of the facility to improve conditions for those detained and align with the national best practices. Our approach has been one that centers around the 3 A's: analyze, assess, and address. 3 fundamental areas. Number 1 is quality of life. Number 2 is safety and security. Number 3 is infrastructure. Next slide, please. As it relates to number 1, quality of life, from May 3rd, 2014, the Justice Center has seen an unfortunate number of detainees' death as a result of medical, suicide, and drug overdose. Insights gained from the investigation and evaluations of the root cause of those prompt the launch of systems and strategies to address each cause. You just heard updates regarding the great medical care improvements from Dr. Mahdi of the Department of Health. In conjunction of their progress report, the Division of Corrections has added more suicide prevention measures. These measures include closer observation of at-risk detainees, identifying key indicators of self-harm language and behaviors, and better coordination and collaboration with healthcare professionals to prevent a behavior crisis. Detainees seeking mental health care increased by 900%, with the mental health list growing from 20 to 200 individuals within 1 year under these new measures. In recent years, the Department of Corrections has also made upgrades to the quality of food served to the detainees. Our current contract specifically prohibits any meals with textured vegetable protein or protein pellets. Every inmate receives at least 1 hot meal per day, and menus are reviewed and certified by the contractor's registered dietitian as adjusted for age, sex, and activity according to the recommended dietary allowances stated by the National Academy of Sciences. Recently, there have been reports of judge orders received on behalf of a handful of detainees. Please know that we carefully review every judge's order pertaining to an inmate in our care. However, upon reviewing of most recent orders, many of them were found to be unsubstantiated. Next slide, please. As it relates to the safety and security, the Division of Corrections is taking steps to ensure the facility is drug-free. These measures have included multiple rotations of the K-9 unit to identify and remove contraband, the introduction of advanced screening technology to better identify drugs, additional screening of staff, visitors, and inmates for contraband, and requiring photocopy delivery of original documents. As I stated earlier, the mission of the Division of Corrections is to ensure a safe and secure environment for both staff and detainees, and at times, use of force is necessary to maintain the level of safety and security. Situations that require such measures include detainees refusing to follow directives given by staff. An example is being in an unauthorized area, which can mean a breach of security. Staff intervening in physical altercations between detainees. This is necessary to make sure further injuries do not occur. Addressing detainees who are intentionally obstructing panhole closure, which if left open can result in a security breach, to facilitate unauthorized communication or exchange of objects between cells. and incidents where detainees throw urine or feces at correctional staff. Although use of force tactics are at times needed and therefore deployed, it is also important to highlight that overall use of force has declined. In 2021, there were 251 incidents. In 2022, there were 130. And in 2023, 105. By the end of September 2024, there were only 70 incidents. This decline is the result of several factors that were recently implemented. Integrating regular and annual training for staff, equipping our correctional officers with the tools and strategies to resolve situations before they escalate to the point where force is needed, and collaborating with mental health providers to address disciplinary issues related to mental health crisis. Since 2017, there have been 9 incidents classified as Class A or Class B use of force events. This reflects the 99% of situations requiring the use of force have not resulted in an injury to either staff or detainees. Next slide, please. As it relates to infrastructure, in Ordinance 71494, the City of St. Louis appropriated $12.5 to the Justice Center, and overall, the Division of Corrections has invested more than $19 million in upgrades to the facility. With the recent bringing on Mr. Doug Burris as a consultant, we are working together to identify and implement reforms related to housing and incident responses. Of the $19 million instructive improvements, we've made to doors, locks, controls, security cables, cell lighting, power supplies, and parking lot improvements, among other things. Next slide, please. The current issue that is trending across the country is that employment, recruitment, and retention rates in a correctional facility. It is important to note the Division of Corrections experienced a decrease in staff. At the same time, it experienced a rise in population, and recreation times depend on staffing levels. We currently have 74 correctional officer positions filled out of 198 positions authorized. And we currently have 10 correctional officer 2 positions filled out of a total of 28 authorized. While we are able to staff the facility, this staffing levels cause additional stress to our officer. Retention of correctional officers is an ongoing challenge. From 2019 to 2021, a total of 85 correctional officers stayed in the profession with the city for less than 1 year. In an effort to increase the availability of correction officers, we have contracted with Gardaworld to provide additional security in the facility. Our current recreation time is, of course, not what we want it to be, as some individuals are not leaving their cells for more than 1 hour per day. To safely and meaningfully change this, we must meet a minimum staffing threshold of 150. Our staffing numbers are low, but our facility is safe and secure. And this is not just a City of St. Louis issue. These are national trend across the country. We are working closely with the Department of Personnel to try to fill these positions. We are offering a hiring incentive of $3,500, and we are still interviewing candidates. With this week alone, I've interviewed 30 candidates. But in reality, that roughly 30% of the candidates we attempt to hire fail the drug testing portion or the background check. Next slide, please. Looking ahead, our focus within the Division of Corrections will be fostering stronger relationship with key partners, stakeholders, and volunteers through regular communication, feedback sessions, and joint initiative to increase stakeholder satisfaction, volunteer participation rates, and successful program outcomes. We currently collaborate with 6 divisions or entities that work closely with us, helping to maintain our mission. We recently collaborated with the Prisoner Processing Unit to effectively manage the intake process. We are working to digitize the professional meetings between detainees and the Missouri State Public Defender's Office. We've started communication with the new sheriff, Montgomery, and we worked on continued access to the facility and the inmates, by the DFOB. DFOB members can have access to the facility when they want, as long as they follow the ordinance. We do want individuals to be trained to ensure safety protocols are followed when they visit the facility. We do have to ensure that the inmates have legal representation and they have clearance from that representation before speaking with the DFOB to protect their Sixth Amendment right. Monthly meetings between the board of members and the DFOB started last month, and we actually had our January meeting today. In the next few weeks, we plan to release an RFP to decrease the cost of inmate tablet use and phone calls. We know that these efforts can be critical in decreasing tension at the facility and improving outcomes once the individual is released. Lastly, we will be reviewing and implementing recommendations provided by Doug Burrs, who's here today, to assist us in the continuation of improvements in the facility. Thank you. Yes, I will speak about the programs. Would you like for me to speak about the programs now? Or you want to ask me a question? Okay. So in the facility right now, we have GED, we have homebound for the juveniles, we have ministry, we have opioid prevention, we have 24/7 dads, we have, for the female population, we have identity and hands-on banking for them. What I've been in contact with some people. We do have people that want to come in and provide educational programs. I'm interested in starting college programs. We have someone who reached out in teaching the females sewing, crocheting. Those are some things that are currently in works.
I guess since I kind of asked about programs, I jump in. I didn't want to be. I know it's hard for the chair to see through the.
Yeah. Go ahead, Alderman.
Got you. First off, is Ms. Ross?
Ms. Ross.
Thank you so much, Ms. Ross, for being here and stepping up to the plate, for being the interim. Were you, I guess, already at the jail?
I was deputy commissioner at the jail.
Okay. And how long was you at the jail?
I've been at the jail for almost 23 years.
Gotcha. Well, I will say, I have heard some positive things about you.
Great.
So, I think you have some. I think a lot of people want to see, transparency and a vision throughout that process. And whatever way the board can be a help, I know we want to be a help in making sure the jail is successful. And me personally, whatever way I can, please let me know. And I know you new in the role, so some of this I know is still a lot of onboarding. Are you in any communication with like the county jail and maybe seeing some of the programs that they have? I know, they used to have kind of a rough footing as well, and it took several directors to kind of get the county on a smooth process. Again, I know the jail is not like an easy probably process to my question, or is there any communications you have with like the county on just like collaborate, well, not too much collaboration, but maybe on some of the things that best practices they've done and programs that they are running in the county?
Sure. I have been in contact with the county. I have toured the county. I have been in contact with some of their top people to hopefully bring some of their ideas to the city. I've done that over the years. I've also been in contact with St. Charles County. So I am committed to doing what I can for our population. I'm positive with that, and I do walk the facility. I do talk to staff, and I do talk to the detainees. So I think these things will help.
Gotcha.
With what's going on in the facility.
Okay. And what do you have I know you only been there for a short time, but do you have one thing that I was impressed with Dr. Mahdi about, and I know again you knew, is kind of a vision that she would love to see implemented. I would say under the previous leadership, even the like handbook hasn't been updated or the operations hasn't been updated in years. Do you, are you working on a kind of a long-term vision for the jail to be successful?
Sure. Right now, my short term is staffing, fostering continued partnerships with different people, resources, bringing those back into the jail. Reentry is a big thing. One of the things that I was excited to speak with the provider about was starting mental health at the beginning when they come into the facility, speaking with them then instead of waiting 14, 30 days later, and waiting for their symptoms or something to show. So that's why we've kind of jumped the curve when it comes to mental health, because they're talking to a professional as soon as they come in, just like they're talking to a medical professional, ensuring their background.
Got you. Well, like I say, if it's a way that in your time that I could be a help, please let me know. Would love to. You know, it's I think a place that's important for all of us at the board and throughout the city. I want it to be successful, and thank you for kind of taking on that role.
Sure. Thank you. Appreciate you.
Do any other members of the committee have any questions? All right. Well, then I'll just jump in. Thank you, Commissioner Ross. I know that jumping into a job in the kind of midstream is never fun, and you certainly have your work cut out for you. But I am glad to see both from Dr. Mahdi and from yourself that there's been both an emphasis on better healthcare outcomes as well as better programming for the inmates. Like I said earlier, I'm a firm believer that most of the people who are in there are going to come out of there at some point and be our neighbors, and the way that we treat them while they're incarcerated is going to greatly affect the way that they view society when they come out. And it sounds like we're making some strides to get better outcomes there. I share Alderman Aldridge's concerns, and there's nothing specific that you can do about this at the moment. But just in terms of having people who may be medium security risks in a high security facility, the idea that people aren't seeing the outside for large periods of time, I think is problematic. I think that we've seen the results of some of that, frankly, over the last few years here. But that is not on you. That's just the layout of that facility, and I know that it would take substantial funding to create any space where people could be outside, and that may not be politically popular to spend money on. But I want to thank you for your work. And with that, unless anyone has any other questions, or if you guys have anything that you would like to close with.
Thank you.
Before we close, I'd like to give Doug Burris an opportunity to speak with you. This is a person in the facility every day doing the analysis for the Justice Center so that we can make improvements in the facility.
You'll be very pleased to know that I have 3 slides, is it? The lateness of the hour. And I was contracted with the facility, if we could go to that, and we probably don't even need to. Alderman, I have to tell you, I was over here laughing when we were talking about the barber shop at the jail, because I was director of the jail, and I said, we need a barber shop in here, and I volunteered to be the first person to get their haircut in the facility. That's still an ongoing program that's produced great results.
Yes, and if I'm not mistaken, you come from you did some work in the county helping out, right?
That's exactly
yes.
right. I was let's go to the next slide, please. And I'll go into that in great detail. Well, because of the hour, not in great detail. But next slide, please. That's good. I have 40 years of experience in the criminal justice and correction system, and I retired for good in 2018, but the old saying is man plans so God can laugh. And I received a call from the St. Louis County executive telling me that the jail was in chaos. Numerous deaths had occurred at the facility. Staff were walking out regularly and violence was out of control. And I came back to work and became director of that facility because I feared what would happen to the people if I didn't. And I'm very pleased to report that within 14 months, there had not been a single death that had occurred. The use of force dropped by 70%, 80%, excuse me. Programming became rampant throughout the facility, and I led with my vision of humanity and safety. And I think there are still incredible things going on. My favorite program that we did at the facility was the college education program through St. Louis Community College. And that program's been in place for over 5 years. The collective GPA of the participants in that program from the jail is higher than the GPA for the Honor Society on campus of St. Louis Community College. And that shows you the wasted talent that we have in many jails and correctional facilities. And they are coming home, so we must do everything we possibly can to prepare them to be successful. And there are things that the city jail can do quickly. Some are going to take significant amounts of time, but there are things that can be done quickly to lower the recidivism rate, and I think just treat people more with humanity. So I had been my contract was for 45 hours to examine the jail. I'm over 150 now, and I'm eating that time up. I won't be paid for the excessive time, but I'm doing it because I'm greatly passionate about this, and it may be my last opportunity to make a huge, significant difference. I've had some great surprises. My report will be out within 1 to 2 weeks, and there will be over 50 recommendations on probably closer to 60. A lot of it has to do with programming, like you were talking about. There is some things that I've so enjoyed working with Dr. Motti. She's been great, and I have to tell you, when it comes to your acting commissioner, some of the defense attorneys who have been enemies of the jail have said before her it was dark and now it is light. So that should give you a real idea of how wonderful of a job that she is doing. But there are some things we're going to be implementing. I have to tell you, the city is also, when I've gone through some of my initial results, has acted incredibly quickly than the mayor's office. And I'm talking about TVs that were broken for the residents getting fixed that afternoon there were 19 windows that I had counted in the building that were broken. And they immediately had them called to be fitted. They're in Alabama being made right now. But one of the things that I think you'll be very happy to see is that the jail one that I'm recommending in this city's already agreed to is team with Missouri Appleseed, and where they have a program that allows people that are incarcerated to go ahead and sign up for Medicaid or Medicare before their release, and then it becomes effective the day that they're released. So the people that have a medication, and there are over 200 people that have a psychiatric medication right now. That's just on the psychiatric end. You can imagine on the other side, just the full medical side. They'll be able to have a prescription called in and have the ability to get services immediately. That's one of the things that's going to be happening. There are so many other things that we do want to bring in the college program. There is a program that the city has already contracted with that provides a computer lab in the blocks where they can do various things. We want to partner with Slate, which in my experience has been an excellent organization in training people, have resume classes, have interviewing skills classes, and other things like that. It's been a great 5 weeks for me, and I have talked with over 50 of the residents, and you probably noticed that I have never used the term inmate. I hate that word because these are people that have not been found guilty, and they are citizens, so I call them detainees or residents, and I actually prefer residents. But I've talked to over 50 of them, over 50 of the staff, and about another 50 of other people, including attorneys that have litigation against the jail right now. And I think you'll be very pleased when the report comes out with the recommendations and the response that the acting commissioner and the city will give in response. Do you have any questions of me?
Yeah, I have a question. You had mentioned the barbershop program.
Yes.
county does. And I know that in the previous, at the Medium Security institution, that was a popular program. And I had just heard, and I don't know, I just heard someone talking about that even if you got training there, that you couldn't necessarily get a barber's license with a criminal background. Do you know if that's the case or
No,
not?
that is, and I've dealt with that for decades, and there is a process, that is true, but there is a process that you can go through to get the license. And it usually shows, if you have someone in authority write a letter of recommendation or something along those lines, it almost always carries it through.
Okay. I was gonna say, I would just hate to put people in a situation where they think that they're picking up a trade or a career only to find that, you know, the door has been shut on them.
Right, right.
That's the only question that I have. I know that your reputation precedes you here, and I'm looking forward to seeing your report and seeing what changes that we may be able to make to bring this facility up to where it needs to be. With that, I'll open it up to anyone else on the committee who has any questions.
No questions. I just quick comment. Like I said, I've heard great stuff about you, Mr. Doug, and a lot of things that you implemented in the county. I think that has been helpful to kind of turn the ship around out there, and looking forward to the same thing. You know, Director, when that report is out, I'm sure you'll share with the media friends first, but or I'm just joking, Sam first, but we also love to, you know, if public safety and the alders can get that report, it would be helpful. I think this is a, you know, like you say, we got new leadership. Sounds like that is a positive. Just looking forward to your experience and expertise and being able to help with the jail that we have with the current leadership of the interim. So thank you so much.
Thank you. I look forward to working with you.
All right. With that,
Can I-
Director Coyle,
We
if
will
you have
share
any.
that report with you once it's done. Hopefully today you kind of see that we're trying to move in the right direction. We're trying to make the improvements that are needed in the Justice Center, and we're bringing the people that can help us do that. So thank you very much.
Thank you. With that, we will move to excused alder persons. I'll entertain a motion to excuse Alderman Velasquez for necessary absence. Is there a motion there?
Second.
All right, all in favor signify by saying aye. Aye. Okay, opposed?
Aye. I'm for excuse, not no.
Okay, well then we'll excuse Alderman Velasquez. And with that, I'll entertain a motion to adjourn.
So move.
I'll second it. All in favor signify by saying aye.
Clark Hubbard seconded. Aye.
All right, then opposed? And we stand adjourned. Thank you.